Recording in progress.
Good afternoon, honorable members. Good afternoon to our support team from Parliament. Good afternoon to those who have logged into this portfolio committee to make presentations. We will start this portfolio committee meeting by observing a moment of silence and meditation. Thank you. Ms. Machalamba, we'd like just to check with you, the honorable members who are logged in today's meeting. Thank you very much. Ms. Machalamba.
Good afternoon and thank you, Chair. Present is Dr. Dlomo, Ms. Shabangu, Ms. Kumalo, Ms. Keko, Ms. Clark, Mr. Mutubatsi, Ms. Mpungose, Mr. Van Staden. I've received an apology from Ms. Sine. She will join the meeting later. Thank you, Chair.
Okay. Honorable members, welcome to this meeting. Any of the other members that might have been left out from the list that our secretary has called in?
No, Chair. Thanks. I don't know. I just got off. I'm not sure if I was called, but I'm present. Mutubatsi.
Okay, yes, you were called in. Yeah, honorable members, we will start now on this last part one marathon of presentations. The last one will definitely take place on Thursday. Today we have other presentations, 4 of them, starting with the one from Cosatu, and then there's another one of a long name, I can't remember it. The third one will be Economic Freedom Fighters, and then there's another a fourth one. So we will have 4. Welcome to the leadership of Cosatu. We will allow you to engage with the portfolio committee. You will have 30 minutes or less to present your slides, which some of us are familiar with them because they came last night. Thank you very much for sending them much earlier. We will then interact with yourself, asking you to get a pen and paper and take down the questions, clarity-seeking comments from the members. Then you'll have not more than 12 minutes to respond to those after the session. So with that, maybe Ms. Machalamba, before I allow them, just show us the agenda rather than me reading the agenda. Then after we are satisfied that we have seen the agenda, we will then get Cosatu to start. So that is what honorable members we are having today. There is a presentation by Cosatu on this bill we discuss, and thereafter we have another presentation by Protect Our Next on its input, and then the third will be a presentation by Economic Freedom Fighters, the party, and then the last presentation will be by Phillip Morris, South Africa. Let me give this just to prepare ourselves. Ms. Chirwa Mpungose, are you going to be leading the presentation, or there will be another leader from the party coming through? Honorable Chirwa Mpungose?
Ms. Chirwa is not presenting on behalf of the EFF, Chair. Somebody else is.
Oh, okay. All right. Thank you. Okay. Leadership from Cosatu, your 30 minutes starts now. I'll give you an extra minute. At 3, we'll at 25 to 4 wrap up your presentation. Thank you very much. Over to you now.
Okay. Afternoon, Chair, and afternoon, members. Thanks for giving us space as Cosatu just to share our views. We've been looking forward to this very important bill for quite some time, and so I think we're quite pleased that it's finally here at Parliament. Chair, just for colleagues' benefit, my name is Matthew Parks from the Congress of South African Trade Unions, and so we have a vested stake in the tobacco bill, Chair. One in terms of workers who work in the sector, be it on farms, be it on tobacco factories or distribution, but also we have a health perspective as well, because there is a strong link, as we all know, between the consumption of tobacco and lung cancer and so forth. So we try to carry those two different caps, so to speak. But Chair, overall, we welcome the bill. We think it is a progressive bill. It's rational. And we think it is providing some useful responses to what is a national health crisis. And we support the different provisions in the bill, Chair, though we do think on the provisions dealing with the regulation of products, that perhaps the Department of Health needed to be a bit more bold to deal with the issue of how to capacitate the state with regards to the effective tracking and identification mechanism for tobacco products. So we have a real problem of illicit or the explosion of illicit trade in tobacco. And that threatens our health objectives, it threatens lives, but also threatens the legally abiding industry and of course those jobs and value chains there. Chair, so I think in our regard, we do urge Parliament to see how do we strengthen the bill in that regard to tracking and tracing. But we also urge Parliament to move as speedily as possible to pass this bill and to obviously ensure that before the end of this administration, it comes into effect. This has been a long journey, Chair, for quite some years, and I think we're keen to see progress in this regard. But we do expect to see some resistance from some parts of the industry, but nonetheless, we need to find the way to move forward. Chair, just with regard to some of the specific provisions, and we had extensive engagements on this bill at NEDLAC, and I think that was quite helpful. And we're also grateful for the Portfolio Committee just to give some space as well for those engagements to conclude, and I think also hopefully to make the task of members also a little bit easier, because you would have then had a benefit of inputs from labor, from business, etc. So on the restriction of smoking in public and private places, Chair, we support this. We think it's a logical extension of the existing restrictions that were introduced in 1995 in the Foundation Act. We support provisions that seek at a workplace to reduce the amount of smoking and the exposure of smoke to non-smoking workers. Yes, the current law does have provisions, but often you find that it's not always being implemented fully, it's not working, etc. When you have smoking rooms in a workplace, often the filter systems don't work properly. You would find some people would smoke at the entrance to a building, etc. So we think the provision of the bill, we seek to tighten workplace restrictions, we seek to prohibit smoking at outdoor premises where other people, members of the public, are present, and of course also to ban smoking in front of children, be it in a public place or private place. I think these are a logical step forward. We do appreciate that at a philosophical level, some critics might say these are draconian, but nonetheless, Chair, we think these are necessary. And of course, Chair, smoking is not a constitutional right. And then when it impinges upon the right to health of all South Africans, especially children who are not able to always assert their rights, then we think then the law has to interfere on behalf of those persons who don't smoke for obvious reasons. And we think the bill and this restriction of public smoking is correct. Chair, with regards to the advertising, and we know that's always a contested space. We know a lot of companies depend upon advertising, but if we're looking at the longer-term health objectives of reducing the amount of smoking, especially for young people, then we think the provisions are necessary. So we do welcome the extension of the existing restrictions for any form of tobacco and related products. And we also do appreciate that, for example, vaping is a relatively new phenomena. And obviously the Act itself, when it was drafted 30 years ago, there was no vaping on the horizon. Again, people may argue that this is a restriction on people's rights to smoke, But I think, Chair, we would argue that the law has to interfere and to take the side of those who don't smoke, especially young people. Chair, I think for us, the cost to public health, the cost to lives. We have many people who die prematurely because of lung cancer. The young age, and of course the cost to the economy, to the fiscus. All of these things, Chair, we think outweigh any right to advertise a product that has been shown overwhelmingly by research to be detrimental to public health care for so many reasons. Chair, we know the packaging issue has been much contested. We know it's often difficult, as things evolve, to always be, have ample evidence. But we think that the research, the international experience that we've seen to date has shown that plain packaging has been a useful tool to try to reduce the attractiveness and glamour of tobacco and related products, especially for young people, for new smokers, and so forth. So we know this is a source of irritation to industry, but we do think, Chair, again, if we have to make a choice, then we'll make the choice on the side of health. And we think that is a useful intervention to further reduce the number of smokers, young people smoking, and so forth. So on the electronic delivery systems, and we know, again, this is a point of a lot of contestation by the vaping sector, etc. But for our perspective, Chair, it makes sense that the Act has to be updated to address this issue. We do appreciate the science is still evolving, or research is evolving rather, for electronic delivery systems, for nicotine, for non-nicotine, etc. But again, Chair, we've got a capacity at the state, at least at a foundational level, to regulate vaping and so on. And then it's going to take time to learn all the full science. And of course, the department can be capacitated through regulations to adjust its interventions, but we need to give it the capacity at a foundational level through the Act to address it. We have seen already some preliminary research from South Africa, from abroad, about serious health warnings, about how addictive vaping has become, how harmful it is, and especially for young people. I think, Chair, if I'm right, there's about 200 plus flavors for some of these vaping products. So we need to kind of really make sure we put in place the foundations to kind of control and to manage it. You can't ban it, obviously, but we need to find ways to try to manage it in a responsible manner. So I think for us, Chair, the provisions make sense for the sector, for the product to be fully regulated, just like other tobacco products. And again, as a department is capacitated with regards to research, etc., the minister be empowered to set regulations, to guide production, distribution, consumption, etc. And similarly, how to manage the issue of advertising. And we've seen a lot of campaigns against the bill by industry. We don't think those are really helpful. It makes sense that we do regulate these products when there's such a significant health impact to society. In fact, Chair, it would be irresponsible for the department not to do so. Chair, on the health warnings, I think for us that's straightforward. Yes, they're graphic, etc., but we think they are important. And again, given the risk we're exposing people to, workers, young people, etc., mothers who are pregnant, yes, and the provisions, Chair, we think requiring health warnings on packages, graphic warnings are long overdue. Chair, with regards to the regulation of products, this is where we do think there is a need to a bit of tightening. So overall, we support the clauses empowering the minister to set regulations governing the provisions of the bill, specifically with regards to the products, to content of goods, where they can be smoked, packaged, health warnings, banning, etc. But we're concerned, Chair, that we don't really delve deep enough, if at all, with regards to the explosion of illicit trade, specifically with regards to tracking and tracing genuine products. And, perhaps there may be an intention to do so with regulations, but that's not clear in the bill itself. But Chair, what we've seen over the past few years, especially since COVID, but even before COVID, Chairperson, before COVID already, you could see illicit trade is taking about, I think, 40% of the market. I think today has gone beyond 60%, if my stats are right. If you go to most, spaza shops, Chairperson, whether it's in the cities or rural areas, you'll find illicit tobacco products, whether it's the single sticks, whether it's the packages or the packs. On average, they go for about a quarter of the price of the legal products. So for us, this is an explosion. It's dangerous, Chair, not just because we're going to attract people to smoke much more. You're going to attract people who don't smoke because it's so cheap. You will collapse the sin tax regime, which has been useful to help fund healthcare interventions. And in fact, you're putting not you, but we are putting the legally abiding industry, those who abide by the laws, etc., pay the taxes and so forth, at risk. Because how do you compete when your competitors are selling the product at a quarter of the price? It's waiting to implode. So for us, Chair, we've been really disappointed about how lax we feel that law enforcement has been with regards to this issue, whether it's SARS, whether it's the police, etc., to deal with this issue. But if you don't deal with the Chair, then we feel in the next few years, the legal regime will simply collapse and the illicit trade will take over, and then it'll be very difficult to dial back the clock. Chair, so I think basically our concerns really is that we're going to bankrupt legal traders unless we do the tracking and tracing, and the legal traders, with all of their sins, at least abide by the law. We feel we're going to collapse the sin tax regime, which is quite useful to manage the amount of people who smoke in the country. And of course, when it becomes cheap, young people will start smoking, and this is going to really create a problem. It's going to actually roll back many of the gains we have made since 1995 on this front. So, Chair, we think for our side, well, look, SARS does work with legal traders on tracking and tracing, etc. They've got stamps, they've got barcodes, but we think, Chair, this needs to really be enhanced and elevated. Needs to be legally binding for all tobacco-related products, and I think, Chair, for a couple of reasons. One is that to capacitate SARS and law enforcement to enforce the rules. Second is to really compel them to do so and not just to be laid back. And you would have seen, Chair, I think it was about a year ago, we had a court case when SARS' efforts to install CCTV cameras at some tobacco warehouses were set aside by a judge. And this is why we think it's critical that to have a provision in the law to enable and to compel SARS to do this. Otherwise, we are going to witness the collapse of the legal regime and the sin tax regime, and we're going to pay a horrific consequence in this regard. Chair, just getting towards the end. So, our proposals basically is some sort of additional wording or subclause in the provisions dealing with packaging, branding, regulations, enabling and requiring mechanisms to identify these products, to track legal products, and to find ways to distinguish them from illegal products. It's not an easy thing. The illegal industry often has a bit of an incestuous relationship with the legal industry. These are well-resourced syndicates, etc. But we need to, as the court judgment showed about a year ago, we really need to capacitate the Department of Health and SARS, etc., to really assist the legal industry and to enforce the sin tax regime. Chair, with regards to sales, we support the provisions tightening restrictions on where tobacco-related products can be sold, including those which seek to prevent children from accessing through vending machines or over the counter, etc. Prohibiting sales next to schools, pharmacies, and so forth. I think those, are long overdue. They're in line with the liquor industry, in line with existing industries provisions, and it'll be a useful further tool in this efforts. Chair, with regards to offences, this had been a point of concern for us in the beginning, but we are comforted. We think, the penalties are fair and rational, and I think the escalation provisions also will help send a positive deterrent to society that will govern us serious about dealing with this issue. But I think, Chair, while supporting these provisions around offences, it's critical that we really capacitate law enforcement, that they're trained, that they're resourced, that they're compelled to enforce these progressive penalties. We shouldn't have a scenario, Chair, where you could even walk outside of Parliament, go to any of the corner shops close by, and you will see, or the guys selling on the streets, the hawkers, you will see the explosion of illicit tobacco products. And unless we begin to really prioritize it, then we shouldn't be surprised when the legal industry and the sin tax regime collapse. So, Chair, in conclusion, we support this progressive bill, Cosatu. We urge the Portfolio Committee to consider tightening provisions with regards to tracking and tracing legal products and to ensure the state is fully empowered on this point. And really, we have a ramped-up campaign to deal with it. And perhaps, Chair, even beyond the bill, maybe useful for the Portfolio Committee and the Standing Committee on Finance to have a joint kind of monitoring sessions with SARS, with the Department of Health, with law enforcement, to really ensure we deal with this illicit trade. It's been a long discussion point in Parliament. I think going back to the fourth, fifth Parliaments, there's been lots of discussions from both the Health and the Finance Committees. Chair, we would hope that Parliament, or confident Parliament, will prioritise this bill, and that we look forward to it to being passed within this term, ideally even sooner than that. So, Chair, let me stop there and thank members for giving us space, and hopefully we stuck to the time frame, and I think just to offer our support to this critical bill, Chair. Thanks very much. Thanks, members.
Yeah. Thank you very much. Thank you very much, Mr. Parks, for your presentation, where we are actually asking that we accelerate the process. But now there are members who are going to interrupt the presentation. Please get pen and paper. May I request honorable members to raise your hands on the platform? Then I'll recognize you accordingly and give you time to speak. Oh yeah, honorable members, I have just been advised by the secretary, if you could, if you are able to, wherever you are, switch on your video as this presentation or this meeting is being taken live by our parliamentary TV. Thank you very much. The first honorable member is Dr. Leroux. That's number one. If you are able to switch on your video during the time you present, we'll appreciate that. Number two will be Honorable Van Staden. So take your numbers down, honorable members. Number three will be Honorable Dr. Letlape. I'm taking hands as they come up. Number four will be Honorable Kumalo. Number five will be Honorable Clark. Number six will be Honorable Mutubatsi. Number seven, Honorable Shabangu. Number eight, Honorable Mare. That's where my numbers end for now. So that we avoid a second
Keko is
round.
also lining up, Chair. Keko is also lining up. Thank you.
After Mare, Honorable Keko. Any other member who is struggling to raise a hand but wanting to participate? None. In this order. Number one, Honorable Dr. Leroux. Two, Honorable Van Staden. Three, Honorable Dr. Letlape. Four, Honorable Kumalo. Five, Honorable Clark. Six, Honorable Mutubatse. Seven, Honorable Shabangu. Eight, Honorable Mare. And nine, Honorable Keko. One after the other, honorable member. Thank you very much. Start.
Thank you very much, Chair, and thank you to Mr. Parks for his presentation. I found it a helpful presentation. I think that he's looked at the issues with quite a lot of balance, and I appreciate his broad perspective. I think that I would also like to agree with him that I think that the track and trace in particular is something that we should consider putting into this law. I know that it's not completely our ambit, but I think that we should be creating legislation that assists the police and SARS in their work. And so I think that that is a good point that we agree with, and that I certainly would agree with. I think the question that I just had is, I think that he does make the point around the concern about that some of the legislation might push people from the using legal taxed tobacco to the illegal trade, which we've already seen. And he has mentioned the concern about the collapse of the legal trade. But it's interesting. You do, Mr. Box, you still say that, you know, you feel that most of the strict laws are there, should be kept. And so I was wondering, you know, a lot of the arguments from the industry side, and again, I'm not trying to defend them at all. I think that I agree with you that it's a particularly on the tobacco side, it's a very harmful thing for our society, but there is a concern that the tax-paying industry who are working within the law are being punished by this. And so I would be interested to hear if there are any signs, any things that you think could accommodate them in some extent to preserve well-paying jobs and to preserve the tax base that you were talking about. Yeah, that would be my only question on that topic. Is there anything that you think we could change in that from that way? Thank you.
Good afternoon, sir, colleagues and chairperson. Thank you for your presentation. It's much appreciated. I only have one question for you this afternoon, sir. My question is regarding the plain packaging. I just want to know if you can please advise this committee if did those countries who implement plain packaging stop smoking in large numbers, or did the numbers of smokers remain constant in those countries? Thank you, chairperson.
Thank you, Chair. I just have 3 questions. Thank you for the presentation, Mr. Marks. My first question, you talk about smoking is not a constitutional right. So my question is, the people who smoke, do they have any constitutional rights? And if so, how can those be protected? The second question relates to regulation of the devices and the products being left to the minister. Do you believe there is the technical capacity and the knowledge inside the ministry to do that task? And if it is left to a minister on technical capabilities, when a minister is a political appointment that doesn't have to have any knowledge about what they do, how do you see that panning out? When you look at things like drugs, they are regulated, but there's an independent authority that is properly resourced, even with the technical expertise, to make the judgments of licensing drugs that come onto our market. How will this be done by the Department of Health? And I have absolutely no problem, but I'm just worried about the technical competence. If you see the levels of innovation in the tobacco industry, almost every day there's a new alternative and a new product. Where is the capacity going to come from? That's all for now, Chair. Thank you.
Thank you, Dr. Letape, for hiding whatever you were hiding there. We appreciate you hiding that. Thank you. Next. I thought I read names and numbers of honorable members. Now that pause tells me that Honorable Khumalo does not know that she is following Dr. Letape. Honorable Clark, come through.
Thank you, Chairperson. The question was asked, what is your view on presentations we've received that stated plain packaging would make the illicit trade easier? And do you agree with that? And what is your view and opinion on that? And then a few presentations have raised concerns that informal traders could be adversely affected and easy targets for overzealous law enforcement, and that the display would be difficult to enforce in such a setting. What is your view on that? Thank you very much, and thank you for your presentation.
Honorable Mutubase.
No, thanks very much, Chair. I want to show my face. I apologize. I'm on the road. But three questions. One, Mr. Parks spoke about the regulations that we need to strengthen them. Do you think the current regulations that are there, especially emphasize around the question of monitoring, if they are not enough, these regulations, and the monitoring is weak, do you think it's necessary to add another burden when we don't have the necessary infrastructure either in terms of personnel or whatever capacity that we can have currently. So that's the first question. You brought an interesting aspect around track and tracing. And you also spoke about illicit trading. And I always say trading for me is not an issue. An issue for me is the production. And the concern has always been we're having legal traders during the day and illicit traders during the night, but being the same people hibernating because it's dark. But now, because we have brought an important phenomenon of tracking and tracing, currently, and most of the people who are regarded to be legal are mostly in the suburban areas, in the chain stores, who receive these cigarettes. And you correctly, or the view that is there, is that most of the people who trade with illicit cigarettes are in the townships. And most of those people are, I can say, your constituency of the working class. Now, the tracking and tracing that we are speaking to, it's an important phenomenon. Do you think currently we only having people that we can perceive as legal in the main chain stores, but being illegal? Do we have the figures that we can present that people who we perceive to be legal in Spa, in Checkers, by right, those are the people who are illegal in terms of trading? Thanks, Chairperson.
Thank you, Chairperson, and greetings to everyone in the platform. And Chair, let me first appreciate this presentation by Cosatu and the support, certain part of their presentation that is supporting the bill. I hear that the presenter suggested that SARS works with legal manufacturers to deal with illicit the marketing. Are you aware that according to Hawks, the supply of illicit market is by the same legal manufacturers? And suggesting that they are to work with SARS to deal with illicit, are you not suggesting self-monitoring? How can the industry that is involved be involved in coming up with the measures to monitor themselves? It's like asking, we are suggesting the fox must help watch the chickens. Are you aware that the same big players in the industry were alleged to have used their relationship with SARS to spy on the smaller companies in an effort to retain their market? Yeah, those are the few questions that I have on this presentation. Thanks, Chairperson.
Honorable Mare, followed by Honorable Keko.
Thank you so much, Chairperson. I want to say thank you for the presentation, and thank you to Cosatu that they have made a presentation. Cosatu is representing the working class. And if I listen to what Cosatu is saying, and we listen to what the previous people were saying, the big tobacco companies was all coming to the platform and saying, if we're going to introduce this bill, people are going to lose their job. Unemployment is already high. More people are going to be without jobs. What is Cosatu saying about that? And the member before me has addressed the thing that I wanted to ask about the illicit trade, because the illicit trade is people that is trading during the day legally, and it's just a way of them to evade taxes. That is my conclusion to this whole thing. And I also would like to know the illicit trade that they are saying that they will monitor and do it whatever they're going to do. They can't do it now at the very moment. How are you going to track and trace when people are doing this on a daily basis? And the mere fact that the tobacco industry is making millions, but no one declare really what they are making because they are paying taxes, but no one really knows how many taxes they are paying. So that is also a concern because it's huge money involved here. So my question to Cosatu is, what are you saying about the fact that these big businesses are saying that there's going to be job losses? Thank you, Chairperson.
Thank you very much, Chairperson. My apologies for not being on camera. I understand the rules of Parliament, but the place where I am does not allow me to show up. Apologies, Chairperson. Chairperson, let me greet everyone, starting by yourself. I am Chair, joining the colleagues in appreciating the presentation from Cosatu. I appreciate more the support that they are giving to this bill. Also, Chair, I am very much glad that an organization such as Cosatu, representing workers and the working class, which are in numbers, Chairperson, which I think they represent the interest of those that are seeking for jobs and those that are already in jobs. Thank you for that support. Also, thanking them with the advices that they are giving us. The advice on illicit trading. It's good to have that joint effort in fighting illicit trading. And also the emphasis that they are putting on plain packaging. They are also emphasizing on that, making strong recommendations. But my question to them would be, what can they advise on age verification now, more so on online sales? Chairperson, I just want to also allude to the fact that some presenters were against the bill, citing loss of jobs and citing other things. My question to those was that where will those ones work if they are sick or are dying of smoking-related sicknesses? It's good that they were there at NETLEC and also they have come in front of this portfolio committee to put their support and also advising on progress regarding the bill. Thank you very much, Chairperson. Thank you.
If Honorable Kumalo, before I close, is able to speak now, is she able to connect? Okay, that was the last chance I was giving her. She's not able to connect. From my side, I'd like just to check a few things. One, it would be nice to hear your NETLEC experience during the discussion of this bill. You didn't really dwell much on that, and I'm glad you did not, because that was not really where your presentation was focusing on. But there are other people in NETLEC who decided to make it their responsibility to, over and above NETLEC coming in to make the presentation to us, to give us a bit of what happened in NETLEC. So I'm really asking you to really indicate if there is what was your experience there in NETLEC. Honorable Marais has already spoken regarding what you were saying about workers and the jobs protection. I wanted to just ask related to that. I've been to some airports and lounges, smoking lounges, and I do speak to the members of Cosatu coming in from those lounges. what do you do when you have to come? Say, look, I have no choice. I'm working. I have to come and clean, even in this room that is heavily smoke congested. So I don't have any protection, but I must come and work. So you also are saying in some way you are supporting the bill to protect some of your members in there. You indicated that you'd like to see some training of the relevant stakeholders in the bill. What more would you like to maybe say in the implementation thereof of the bill? Without undermining the question raised by Honorable Shabango on illicit trade, but I like your suggestion that, which is very opposed to some of the presentation, to say fix the illicit trade first before you bring this bill. You are saying let's work along on this and improve and get other stakeholders to really put their heads together on this matter of illicit, because you can't ignore it. But however, you can't prioritize it only and say let's deal with that only until it is sufficiently dealt with. Because I doubt if there's any country that could actually eliminate completely illicit trade. So your comments on that I really welcomed. May I just check before I ask you, Mr. Parks, to answer if Honorable Khumalo is able to speak? I gave you that chance now.
Thank you, Chairperson. I'm very sorry, Chair. I'm having the problem of network. I'm very sorry, Chair. But I think
Honorable Khumalo,
Yes.
we are going to be in this meeting until 8 o'clock tonight. And the meeting
Yes.
is not an emergency. It's known to all of us. We need to be in a space, because we are not done after the statements. We are going to be in a space of 5 hours in a meeting. So if you struggle now, please try and get a better place that is going to make you to be connected for the next 4 hours.
It's not used to, Chair. It's really not used to. But I think my questions were asked by other members, especially the concern that was raised by Cosatu, the issue of tracking and tracing of Guinean products. I needed just to check, Chairperson, what measures would they suggest to address this concern? And also the issue of jobs loss. I needed just to check with him. Or are they not having any concern about job loss? Or what comes first to Cosatu is the issue of health of the people in South Africa. That was my only question, Chairperson. Thank you.
Thank you very much, Mr. Parks. You will have to start now, 20 to 4. At 5 to 4, you will have wrapped up. Thank you very much.
Okay, no, thanks very much, Chair, and thanks, members. I think, Chair, one appreciates that members across party lines, approaching this from a very progressive stance. We appreciate, Chair, there are contradictions, with anything else in life. I think, Chair, for us, overall the bill is a good bill. You'll never make everybody happy. That's impossible. I think for us, Chair, our real concern is around tracking and tracing, that we're not being bold enough with regards to what is really a crisis. And I think that's why our plea to honorable members is to consider some clauses to see how do you really capacitate the state, whether it's SARS, it's SAPS, it's the BMA, the Department of Health, etc., municipal police, etc., to really deal with this issue. And not just to capacitate them, but also to require them too, because often you find government institutions, if you don't spell it in black and white, they won't do it. But if you put it there, Chair, then it's a useful tool for members of parliament, be it the Portfolio Committee on Health, be it the Standing Committee on Finance, etc., to call the department, call other institutions of the state to say, what exactly are you doing in this front? It's not some obscure issue, it's a major issue. Chair, I think for us, we are witnessing an explosion. We think about being, fear-mongering. We'll witness the collapse of the legal industry in the next 5 years. The rate the illicit trade is growing at, it's just simply not possible for the legal trade to compete. If you're selling a product at 40 Rand a pack, and the illegal one is a 10 rand a pack, so give or take. We do appreciate, Chair, that there is an incestuous relationship in the industry, that you have some parties who have their hands in both cookie jars, both the legal trade and the illegal trade. That's fine. We must do that hand which is in the illegal trade. We must hit that hand very hard, so that a lesson is taught, so to speak. But Chair, we do think there is useful practical intelligence that the state can benefit from the legal trade, because there is, for those who abide by the law, there is an inherent competitive need to deal with the legal trade. And I think that's where our interests coalesce. You know, in a normal society, we might simply say, we're going to ban smoking because it's not good for you, it's fine. But we don't live in a normal society. It's not realistically possible. And hence we do see where there's an alignment of interests. There's an alignment from the state, from public health care. There's an alignment from the legal trade in terms of the ability to trade. And of course, there's an alignment of jobs in the legal trade, and also there's an alignment of the sin tax regime. So I think we need to exploit that, not to just simply think that we're not going to engage, because we do feel we're going to see the collapse of the sin tax regime, and not so much concerned about the loss of money to the state. Yes, that's important, but that it'll actually undermine all the efforts over the past 30 years plus to reduce the scope of young people smoking, etc. We think there is useful intelligence when we've engaged with the legal trade. We think they've had very useful practical tips around tracking and tracing, etc., whether it's around domestic factories, whether it's around smuggling over the border post, etc. And I think that partnership is needed. You would need a just transition. So, Chair, I don't think what we're saying is self-monitoring, because that would obviously not work. That's what we think is useful. Just at a high level in the bill, you compel the state to do the tracking and tracing. Through regulations, through programs, you can spell out the practicalities. Is it a CCTV? Is it a stamp? Is it a barcode? Whatever it might make sense. You might not be able to have all the practicalities in a bill, but in regulations, yes, you could have. But I think in the provisions of the bill, you compel the state to do this. Chair, I think also it'd be critical that government, Department of Health, Cabinet, Parliament, also that we look at the issue of the illicit trade protocol and see how do we expedite its ratification, how do we then move on to its domestication. But we think a lot of these things in the bill, if you can do the tracking and tracing, can actually help to do that. Chair, on the plain packaging issue, and I think even other issues too, if you listen to any industry, they will always tell you that change is impossible. That if you do any change, you'll see millions of jobs being lost. And that is the debate industry brought with the health promotion levy, the sugar sweetened beverages tax, 10 years ago. It's the argument industry has made around the carbon tax, etc. And look, even if half of the job claims are exaggerated, it's fine. It's part of the normal propaganda of engagements in public debate. But if you don't have a law to change industry, to change its behavior for the better, then industry will never change. The fact is that there's a public healthcare crisis that has an impact upon working class families, etc. And part of this thing is to change behavior for the better. Yes, there needs to be a just transition, because you can't afford just a big bang approach, because that can collapse the legal industry. But besides that, Chair, the real threat to the legal trade regime right now is the explosion of the illicit trade. With or without the bill, the legal trade will collapse if we don't intervene on the tracking, tracing, the illicit trade, etc., etc. So, Chair, on plain packaging, look, I think the one positive example that's always been cited is Australia, that has helped to reduce the consumption of cigarettes. The argument that industry has made, the legal industry around plain packaging will make it easy for the illicit trade to sell its products. Look, one can have that debate. I'm sure there's merits on all sides. But I think the illicit trade is so sophisticated, Chair. I don't think they struggle, because they already do the printing. They print the glossy, the pretty, the sexy colors for the cigarette packages. I don't think they'll struggle on plain packaging. So I think for us, Chair, the argument for plain packaging is really about reducing the attractiveness of smoking to young people. I'm not saying it's the end of the road, but we think it's useful in that regard. The rights of the smoker, sure, one has the right. One has the right to, and we consume a lot of terrible things in society, no problem. But I think what makes tobacco different than, say, for example, consuming a soft drink? Is that it has an impact upon people who are not consuming with you. It has an impact upon your fellow workers at the airport, chairperson. It has an impact upon your children, your spouse, etc. People in public transport next to you, and so forth. And so it's right to err on the side of those, the majority who don't smoke. You can still smoke, but in a place where it won't affect others. I think that's what the call of the bill is saying. And it has made sense, Chair, because, even in Parliament, for example, Chair, for the parliamentary staff in 90 Plain Street, you have the smoking room. But the filter is not sufficient enough to protect non-smokers. I think that's the point the bill is making. Does NDUH have the capacity to enforce? No, sure, it struggles. All institutions of states will struggle to enforce any law. You will also struggle to implement the laws, to get society to abide by them, but you must still do it because you want to nudge society in the right direction. You won't get 100% compliance, even with murders. It's a criminal offense since the biblical era, but people still kill people. Doesn't mean you don't have the law to deal with it. But I think for us, Chair, it's really about how do you capacitate the state? One is through laws, the regulations. It's through public education. It's through training of health officials. It's through training of teachers around what message we send learners at school. It's the training of the police officers and also requiring them to give reports to Parliament, etc. And it means you must give the Department of Health adequate resources. But again, it'll be a journey, but we must still do it, no matter how difficult it's going to be. But again, I think, Chair, it's useful to partner with the legal industry who've got live intelligence, and also to partner with civil society organizations, health NGOs, who have a lot of expertise and also can help, put pressure on government to act. We have felt here at times Department of Health is far too lax about some of these issues. When we discussed the health promotion levy 10 years ago, etc., extensive engagement at NEDLAC, Chair, Department of Health promised us they were going to take this issue of public education seriously. We're going to go to schools to teach kids about healthy lifestyles, healthy diets, etc. Since that time, we don't see any movement by Department of Health. So I think, Chair, it's a good question by members about capacitation, and we have to force department, even Treasury too, on that regard. Chair, on the issue of informal traders, no, sure, some issues might be difficult practically around like display, etc. It's fine. Regulations can work on that. But we have to deal with the issue of people who break the law, and most informal traders won't break the law. Yes, it's easier to police the retail sector, so it's easier to police, a ShopRite or Pick n Pay because it's a large footprint. You can hold them accountable, etc. And yes, it's right that most of the illicit trade goes to informal traders. Some goes to others as well, but we've got to make a few examples. We have to see a few people going to prison, being fined, stock confiscated, because that's how you're going to send the message across society that we're serious about it. So yes, government's got to get its act together. I think the real issue around public education, Chair, but we do think there's a strategic value in a partnership with legal industry because they can really help you pinpoint, because of their own competitive need to deal with illicit trade, can give useful intelligence to SARS, to Department of Health, to SAPS, etc. Chair, just getting towards the end, the impact upon workers. People are dying prematurely. They can't take care of their families. Families lose loved ones. They lose breadwinners. The workplace productivity is disrupted. There's a cost to the economy. There's a cost to the fiscus, to healthcare, etc. So there must be a just transition, Chair. I think if I'm right, we have about 500 tobacco farms. So we should be trying to assist those tobacco farms, for example, look at alternative products to assist the industry around alternative products, etc. But I think for us, the biggest threat really to jobs is the illicit trade. And if you want to protect jobs, we've got to deal with the illicit trade. I think for us, that's the most critical thing. Chair, I think also the cost to the fiscus as well, if we're right, we've seen figures of 20 billion rand, 40 billion rand. And again, we're talking about a shortage of nurses, of doctors, of paramedics, of medicines, aging hospitals, etc., clinics. We can plug a huge hole if we can deal with this issue. Chair, on the issue of age, we think the provisions are helpful around, the vending machines, the shops, the online trading to deal with the age issue. But again, we need to enforce the law with regards to traders who often don't ask for the IDs. Chair, just getting towards the end. Chair, I think I'll come to the NEDLAC issue last. I think, yeah, the issue of exposure to smoke, Chair, by non-smokers, you're right. There's the issue of workers. There's the issue of children. We have to err on their side. I think, Chair, in the capacity state, I think we've covered it, but I think just to make a point, we're in a crisis. If we don't act, and this bill gives us a platform to actively strengthen it, we'll witness the collapse of the legal trade, of those jobs, and the sin tax regime. And I think all of us should review on that. I think, Chair, just lastly to your question about NEDLAC, we had pushed hard as Cosatu to get the bill to NEDLAC. We had been chasing the department for about 5 years plus. We were quite, appreciative, Chair, when the committee gave space for NEDLAC. I think for us, the frustration was from our side was with both the Department of Health and with business. We felt we had a unique opportunity to see how do we find the common ground around the illicit trade, because that's where all of us have the same interest. And yes, we know the legal industry, they're not angels. They're not going to nominate them for the Nobel Peace Prize. It's fine, but we all agree on the need to deal with illicit trade. And I think, Chair, Department of Health, without punching up on them too much, they could have done more on the tracking and tracing. I think for us that was a missed opportunity. And similarly, Chair, we think industry too could have tried to understand the Department of Health's mandate around public health care. But nonetheless, Chair, look, that's water under the bridge. And life will go beyond this bill. We think there's a need for ongoing partnership between NDOH, the legal trade. Yes, you may not love them, that's fine. But on this issue, we have the same vantage point, Chairperson, around public health care, the sin tax regime, enabling the legal trade to take place, protecting jobs, and dealing with illicit trade, etc. So, Chair, hopefully I've answered the questions, Chair, and hopefully I stuck to your time. I know you were very indulgent, Chairperson. Thanks, members. Thanks, Chair.
Thank you very much, sir. We've really been greatly enriched by your presentation. Also because you are a member of NEDLAC, in part of business, as part of the workers and also leadership of the civil society. Thanks very much for that. It was very refreshing to hear the other side of and where there should have been improvements and gaps in terms of that process, which we have really been getting some snippets of it. But yours also is an add-on to what we really appreciate. I'm humbled by your boldness because there have been some people who have been speaking on behalf of the workers, and they have said certain things. And you are having a very, what I could say, a view that is also balanced on the issues of workers. And it's actually refreshing, but you are the one who has got a mandate, and of course, with other trade unions in the country to speak on behalf of your members. You get it fresh from them themselves on the floor, on the shop floor. Thank you very much. We will continue to engage with your presentation even beyond this, because it will assist us as we wrap up and round up the bill. We hope to do close to what you are suggesting, but it's up to the members when we get to the clause by clause, how quickly and how strong we do this and that. Have a great day, but you can still remain behind. There are other presenters who are coming in after you, but thanks for your presentation and your responses. Honorable members, we are now going to take the next presentation of protect the next, probably what the next generation or the next lot. We will hear from the presenters what they mean, but the next presentation starts now. You are given 30 minutes, Honorable, whoever is presenting, to engage with the portfolio committee. Thereafter, we will request you to take pen and paper, wait for honorable members to raise questions with you, and then you come with your responses, probably not more than 12 minutes like Mr. Parks has done. So your 30 minutes starts now. Thank you.
All right, thank you, Chairperson. Just showing everyone our faces. We pre-recorded our presentation as video is integrated, so I'm just going to share that with you all.
Good afternoon to the Chair, honorable members of the Portfolio Committee on Health, online attendees in South Africa. I am Zinhle Ngcobo.
I am Sipesihle Gwambe.
I am Pumulo Khalapa.
I am Kulade Ayo Yusuf, and today we have the honor of presenting Protect Our Necks to you all. We are in support of the Tobacco Products and Electronic Delivery Systems Control Bill. Welcome to Protect Our Next, a campaign and a coalition of a diverse and committed individuals and groups. We are a collective of researchers, scientists, and academics, alongside media and communication specialists. We include public health experts, leading health organizations, and innovators who are pushing South Africa forward in every way possible. Our coalition is made up of those who are deeply engaged in advocacy work and the youth groups who are shaping the future.
We are much more than just that. Together, we are global citizens, Africans, South Africans, committed to bettering the lives of our communities and ensuring a healthier, stronger future for all. We are South Africans for South Africa. We believe in a long and healthy life for all South Africans.
Nna ke a o support-a malao le tlilego ka ona ka gore o tlo thuša ebile o tlo fokotša wa e bona o tlo thuša ebile o tlo fokotša gore le bana ba tlo ba kgole le tsona dilo tša go tshwana le tšekwe ka gore lena ga le šetse le tsene kušare le tlo tiša letsogo and le tlo ba le tlhokomelentšhi mo strateng mo gare ga motse gore metsoko le dilo tše sepela buang ke mo o tlo bona go tlo ba le batho ba bantši kušare le ba ba sa tšong ba ithute go goga bua le ka nna ba ka se fihle.
Protect Our Next combines grassroots mobilization and policy advocacy to influence behavior and legislation.
Protect Our Next is supported by the South African Medical Research Council, the Campaign for Tobacco-Free Kids, the Africa Center for Tobacco Industry Monitoring and Policy Research, and CODS Agency.
At the heart of Protect Our Next is a strategic communication framework we call Citizen, Community and Country. This tiered approach guides how we map, segment and engage our audiences, ensuring that messaging is relevant and effective at every level of society.
Protect Our Next is a multi-layered impact strategy that ensures that our messages are not only targeted, but timed, placed, and personalized to create maximum relevance and impact. Our day in the life strategy is grounded in the belief that communication must reflect not just who people are, but how they live.
The Protect Our Next campaign demonstrates the effective tobacco control, not only on good policy, but strategically engaging the people it aims to protect. Targeted communication, when grounded in local insights and behavioral science, is not a luxury, it is an imperative.
I 100% support it because I think even when it comes to a health system, tobacco is harmful to our lungs and the health system. When it comes to a rate, a number, yezifo zofuba abantu abaphathwa isifuba izoncipha.
TB due to my stepfather was smoking, and one of my brothers, he is smoking also. So I don't know whether it was the cause, TB was the cause whatsoever, I don't know.
Abantwana bayathi nabo ufuna abanokubona i-environment esiphila kuyo nje i-use tobacco i-exposed. Mina kimi sengakujwayela, but into eyayingiphathe kabi ukubuka uma ngibheka umntwana omncane eba exposed ezintweni ezikanje bese mina ngi-expect ukuthi athi mayekhula abe umuntu o-perfect angabhemi because most yama-parents abantu ababazali bayabhema.
Tobacco remains one of the gravest threats to South Africa's health, economy and future generations. Every year, around 32,000 South Africans die from tobacco-related diseases, and smoking is behind a third of cancers, over half of lung cancer deaths, and even worsens TB. In 2016 alone, more than 200,000 hospital admissions were linked to tobacco, while 7.7 million non-smokers, many of them children, are exposed to secondhand smoke at home.
Nicotine is highly addictive, worsening anxiety and depression, while so-called safer products like electronic cigarettes still carry serious risks, proving that there is no safe form or safer product. The economic cost is staggering. Tobacco drains 42 billion annually, nearly 1% of our GDP, through healthcare, lost productivity, and early death. Smokers take more sick days, lose a month of work to smoke breaks, and in poor households. Cigarette spending often replaces food or school fees, trapping families in cycles of poverty.
Perhaps most worry, our children are on the front line. Most smokers start in their teens, some even before 15. And now vaping has surged, with nearly 1 in 6 high school learners using e-cigs, compared to only 2% smoking cigarettes. Tobacco is still sold near schools, often at kids' eye level, or as single sticks. And the industry is aggressively marketing new nicotine products to African youth, grooming them as replacement smokers.
Ngoba kuyafiwa manje abantwana bafa basesebancane ngalento lebasibhemayo angisho akwazi ukuthi lento njengoba isonjoba siyibhema awuyazi ukuthi ku-affecta kanjani la kuwe even umntwana mongambuza ukuthi hayi why ubhema lento le angeke akuphendule uyibhemela for ini angeke ukuphendule uzwa ini mawukuba ubheme lento le yini lento oyizwayo uma uyibhemile.
Lost 2 cousins to hubby. Yes, there was in the lungs were full of water. There was water in the lungs. He got admitted to ICU. Then the next he passed on, and then same applied to the other one. Same thing.
Mina ngumlalo nekhondela ngiyayisupporta i-tobacco bill ngoba izosiza abantwana bethu nezizukulwane zethu.
Ya babona ba batsi ba go le ba ke phela go le bona. So I sharp ga botse yona ka gore e feletsa e ria gore motho gore a ke re bona gore e feletsa e khosetsa motho maletse mo mmeleng ene le ge o goga cigarette ya le mo gausulweni ke moka motlhomo ne bothata jwa mafatlha
ntala nabantu babhemayo kinengane ebhemayo futhi nomakhelwane bakhona ababhemayo nengane zabo zabhema la ekuhlaleni impela akijabulele ngezwe ama-scientists basho bathi ama-chemicals adonswa yilo muntu ubhemayo only 30%, 70% is the one which is next to you. So really that thing yangenza ukuthi ngibone ukuthi ngempela ukuhlala kuduze komuntu ubhemayo noma abhemele ngaphandle abuya kusanuka kimi esasa irritate kanjalo. Mina njengo Mathabatha Jackson Mujapres have said, I really support the tobacco bill. Ukuthi izawusinceda. I think everybody, if maybe we can stop this thing here, why? So when life will live a little bit longer without any disturbance.
In South Africa, tobacco takes many forms and each one harms. In 2021, nearly 1 in 4 adults smoked cigarettes, with men far more affected than women. Alarmingly, almost half of smokers buy single sticks, keeping tobacco cheap and accessible. Snuff use remains widespread, especially among Black women. While hookah smoking, driven by sweet flavors, social culture, it has become common among school learners and students. Vaping is rising fast too. It's not limited to affluent schools, it cuts across communities. Beyond direct use, second and third-hand smoke kill thousands and leave toxic residues that harm children long after smoking stops. Together, these trends show how deeply tobacco endangers our people and our future.
South Africa's youth aren't just the future. They are the present force of change. Comprising 1/3 to even over half of the population, they wield demographic weight and energy. Youth activism today spans health, social well-being, economic justice, educational equity, gender-based violence, and climate action. And this is facilitated by digital tools that enable connectivity, innovation, and mobilization. In 2024, we've seen them turn out in droves to vote, form powerful advocacy movements like Equal Education and Inkulu Vryheid, and lead digital and creative enterprises through platforms like Levity. Youth voices, from young climate activists like Yola Mugogwana to grassroots organizers, are shaping South Africa's path forward.
But our youth are in crisis. South African youth are facing a crisis of unprecedented scale. Over 62% of young people aged 15 to 24 are unemployed, with 46% of those aged 15 to 34 jobless. These challenges fuel mental and physical health problems. At the same time, social isolation is on the rise. Among our youngest generation, over 1 in 5 experience profound loneliness. And these pressures are compounded by soaring violent crime rates. Almost 77 murders per day, making safety a daily concern. Together, these factors point to a generation under siege, one that needs holistic supports now more than ever.
O tshwantse gore wena o tsebe gore na setšhaba sa hao se phela bophelo bo bo lokileng. Setšhaba sa hao se thola dintho tse di right. Because you are a leader. O batla go bona setšhaba sa mofuta mang, first of all. O rata go bona e le tšhaba se se ntsenyang, especially bana ba rona, youth ya rona. O rata go bona eng mo go bona. Yes, mmuso wa rona o tshwanetse gore o dire melao, because rona the time re be re gola papa, we know gore even le matekwane na tshwarelwa. So even the cigarette, papa, it was not ntho e leng gore is an easy thing gore ngwana a tshwantse gore a e rekisetswe. Melao, where are those laws? E kae melao eo ya pele eo? Ene e ne se ke dumela gore melao ele e ne le gore batho ba be le bophelo bo bo better. Mo utlwisisa e ne le gore batho ba nne le bophelo bo better. Ene ba lebeletse hape advantage ya ntho eo. So re need a melao e leng gore e tlo kgona go thusa gore as a belief as rona re le batsadi bana ba rona ba be le bokamoso bo bo better. Nna mme Martha ke a supporta bili e mme Martha Rashetle because ntho e ya dikwai ya utsuba e destroy bana ba rona.
Let's get in deeper with our youth and see why they mean so much to South Africa's future. Let's talk South Africa's school-going youth. School learners make up a powerful 20% of South Africa's population. A whole generation whose health, education, and well-being will shape our country's future. Investing in them means investing in prosperity, innovation, and social cohesion. And here's the urgency. If 1 in 5 South Africans is a learner, then every cigarette, every vape, every exposure to tobacco threatens not just individuals, but a fifth of our nation's future workforce, leaders, and innovators. That's why Protect Our Next matters now.
Our schools are in distress. Children face abuse, violence, bullying, substance abuse, and social challenges every day. It's a silent crisis that undermines their future. Substance abuse among South African school children is not limited to illicit drugs. It's a growing epidemic. A Johannesburg-based study found that 31% of grade 8 to 12 learners are using substances, with many being poly-users. This behavior gives rise to school dropouts, absenteeism, and degrading learning outcomes.
A UCT study of 25,000 learners shows vaping is surging from 9% in grade 8 to nearly 30% in matric. And in some schools, almost half of grade 12s vape. But cigarettes haven't disappeared. 17.6% of learners still smoke, nearly 1 in 6. And hookah is rampant. A quarter of grade 8s and 70% of grade 12s have tried it. The reality is clear. Nicotine use in schools is not declining. It's diversifying and spreading fast.
Even my mother said, Trisha, leave this. I'm not gonna leave it. I'm still gonna smoke with my friends because I'm addicted to them. I have to leave because something happened.
It as a problem would have been cut down, but now because they make it so much of a gift towards your pain and not even towards the mental self, as the youth we literally just take that lesson instead of looking at what the lesson is hurting us and not what it's trying to teach us. So we take the cigarette, we take the vape, and we take the hookah, but nothing from an elderly side, from the governmental side, from the systematic side is being done enough to help us as the youth quit smoke.
Every industry, from tech to fast food, beauty to entertainment, is eyeing youth as their next major market, deploying branding, influencer campaigns, and youth-friendly messaging to shape the tastes, habits, and loyalty of an entire generation.
So why are SA youth the next big thing? South Africans aged 15 to 34 control the substantial pockets and annual spending. while a digitally savvy, well-educated youth consumer class, ages 18 to 37, with nearly 24% earning over 20,000 Rand a month, drives trends, retail momentum, and social influence. Young South Africans prioritize spending on essentials and lifestyle, such as clothing, groceries, dining out, entertainment, digital services, and self-care. And big tobacco is no different. In South Africa, tobacco companies are using social media, deceptive reduced risk spending, and aggressive marketing to minors, contributing to the fact that nearly 24% of youth aged 15 to 24 already use tobacco products. And with about 90% of smokers becoming addictive before age 25, youth are the industry's targeted demographic for sustained addiction. Here are some of their tactics.
From Joe Camel-style youth-targeted ads in the past to flashy point-of-sale displays and flavored vape campaigns today, Big Tobacco has repackaged the same deceptive tactics, always with their sights squarely on youth. The strategies here are evidence. Their aim: replace their now depleting consumer base by topping it up with potential new customers, the youth. Although we have strict advertising regulations for traditional tobacco products, the industry has adapted. The tobacco industry now uses influencers and social media marketing, often disguised as lifestyle content, to subtly rebrand harmful products as desirable to youth. The South African Tobacco-Free Youth Forum warns that sleek designs and flavoring gimmicks glamorizes vaping, luring young people into high nicotine addiction under the guise of harmless tech chic. Youth are not incidental to these industries. They are central targets. The tobacco industry have long leveraged music, sports, and cultural events as recruitment grounds, embedding brand identity into youth culture. Meanwhile, flavored tobacco, whether menthol or bubble gum, it's not accidental. It is designed to smooth initiation and boost youth use. Research shows adolescents consume flavored cigarettes at rates more than double that of adults. On top of that, e-cigarettes are marketed as fun and harmless, yet flavor is a main trigger, with 70.3% saying they're using e-cigarettes just for enjoyment. It's clear the tobacco industry is taking advantage of young people's habits, and the industry is shaping a future of an addicted generation.
Obani bana b'abanyani kubana batsiba vape ukitsha bana bathu babaholo and vape ke yona e senang mafahla bana b'abanyani ka gore ba sale ba banyane. I believe big tobacco is responsible for our youth, health, and future because of their products.
So, are their tactics working? You tell us.
Do anything for truth. 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 Oh, they got truth. They got truth.
In a recent social media video, the Vapor Products Association of South Africa implied that parents and family members are to blame for underage vaping. But insights from educators, learners, and families suggest a different reality, one shaped far more by youth-targeted marketing, accessibility, and industry tactics, coupled with misinformation and peer-led pressure.
So here's a question to the industry. Do you sell your products to minors? In a supervised social experiment, a minor, aged 13 at the time, easily purchased nicotine products and was asked for her preferred flavor. In fact, she was even advised on selecting a high-strength nicotine option. At a Caltex convenience store, disposable Elf Bar vapes were offered in enticing flavors like coconut melon. This demonstrates how readily accessible and and normalized vaping is for youth, even when regulations are in place.
Easy, the effects of this thing, the branding, the marketing, the structuring of the packaging in itself, it doesn't scream, hi, I'm dangerous, but like, I guess they're doing it for sales, but like, that is actually a hook that draws these young people.
In sporadic incidents, huge incidents where kids have been caught in the bathrooms, and we are in the high school space. So the evidence of them actually starting up vaping is here now. Kids are looking for quick fixes to camouflage anything. And this has been throughout history. But because vape is now the new in thing, and it seems to be safer as opposed to picking up a cigarette, it's quick and easy, and then it can also be easily camouflaged as well.
I do support the bill. I believe that there is a section of the bill that even covers e-cigarettes and vaping, and that is what the youth is turning to these days. The youth is actually moving more onto the vaping devices, and I believe now this bill, it puts age restriction on the age limit of learners that can buy these vaping devices or e-cigarettes. And then even the advertising, there is a restriction on the advertising, or there is a ban on it. And I'm happy that it's actually addressing not the traditional tobacco, but these new ones that are coming out, e-cigarettes, vaping devices and all that. So I do support the bill.
The industry likes to talk about harm reduction, less harmful, harmless, or safer alternatives. And yes, that may be a conversation for adult smokers who are genuinely trying to quit. But when it comes to children who have never smoked a cigarette in their lives, we cannot call this harm reduction. We must call it what it is: harm creation. The deliberate creation of new addiction, new damage, and new generations trapped in nicotine dependence.
Data on socio-demographic use of tobacco and nicotine show that emerging tobacco and nicotine products, specifically e-cigarettes, are primarily used by younger populations. According to GATS, e-cigarette use was significantly higher among the 15 to 24 age group compared to the overall adult population. E-cigarette use among young users who had never smoked before has been shown to have increased between the period of 2017 and 2024. Among university students, current prevalence of e-cigarette use was reported to be 26.3%, and of that, 12.5% of students use e-cigarettes on a daily basis. Nearly 14% report using multiple products, cigarettes, hookah, and e-cigarettes together, showing how e-cigarettes are expanding nicotine addiction among the next generation. This is harm creation, not harm reduction.
So what are we doing about it as Protect Our Next? Welcome to our National Impact Campaign, a national tobacco-free schools and community program, where it's all about back to basics, back to school, back to health.
Our aim is to protect tobacco addiction before it starts, empower the next generation to say no, turn classrooms into frontline centers of change for their homes and communities, support regulations like the Tobacco Control Bill,
host tobacco-free assemblies to establish key purpose and celebrate school and community participation,
class to class, grade to grade, e-cigarette awareness workshops and engagement.
Data is packaged in a relevant way to school-going South Africans.
We extend the messages to the entire school community, from the taxis that drop off the children, the vendors that sell goodies to them throughout the day, their teachers, the school community, their parents, and their communities. We want to re-engage schools as a tobacco-free, safe hub. But we don't stop there. Unlike most industries that pop in and leave, we stay invested. We empower future forwarders, young leaders and advocates to co-create, to speak up, and to carry tobacco control forward long after we have stepped away.
And they're not protecting us, they are killing us. I believe that vaping is one of the dangerous things, it's one of the hazardous things that you can do to yourself. There are people who create tobaccos. They are only benefiting from us dying.
Smoking is a choice that people choose to take even without knowing that it's going to affect you in the future. But they take it because they're influenced that if you smoke, it's going to relieve stress. But actually it doesn't. It affects you.
I was inspired as you were talking about how to stop tobacco. So I would say for us, let's stop using tobaccos. Let's fight against these people because we want to be brighter than them. As like I know one of my friends vapes and I want to stop him from doing that. And it's not nice to see people close to you die.
I would like to be because I knew someone who smoked and died, and which was my father's brother, and that was really people. So I like to encourage people to stop smoking because the same as a people.
I want to be a junior advert so that I can help my youth. As for my classmates, some of them that just smoke, I don't say because I'm a good friend to them. I want to help them because I know in the future, about 3 or 4 years, some of them are going to drop out, some of them are going to fail and repeat and keep repeating. So I want to help them so that they'll have a better future, just like me when I grow up.
Smoking is ruining young children. It is damaging the future generation. It is giving us pain, misery, and suffering. It is getting our air polluted, and people aren't realizing that. But we have to realize it. This generation has to fight for the next generation. We have to fight for our kids, our upcoming kids, our unborn sisters and brothers. We have to be one. We have to be united.
Honorable members, what are you going to do about it?
Our recommendations.
Pass the Tobacco Control Bill.
Honorable members, we need a clear definition of nicotine-containing products to ensure that these newer products, such as your oral nicotine pouches, are included in this bill. We need to regulate e-cigarette and nicotine-containing products. We need to replace may with must throughout the bill. We need to extend Clause 4 to include relevant and related products and nicotine-containing products.
Clause 9 provides for the restriction of sales in respect of relevant products and related products. This should be extended to nicotine-containing products in respect to the sale of these products to minors. Clause 5 looks at the packaging and labeling of tobacco devices, electronic nicotine delivery systems, and electronic non-nicotine delivery system. This clause can address the issue of attractiveness and flavors. The minister must introduce regulations requiring ends to have standardized packaging with graphic health warnings.
The proposed measures in this bill are true harm reduction, designed to protect children, prevent initiation, cut consumption, save lives, and ease the massive burden tobacco places on our health system and economy.
We seriously urge you, members of the committee, please pass this tobacco control bill and save South Africa's health, wealth, and future.
Hello, members of the Health Portfolio Committee. We are junior advocates from schools across South Africa, and we need your help.
We are here to urge you to pass the Tobacco Control Bill in Parliament. This bill is crucial for protecting our health and our future. Many of us are seeing an increase in e-cigarettes and vapes in our schools.
These products are addictive and harmful, and the risks are not widely known.
Without this bill, many more young people will fall victim to these dangerous drugs.
Our health and dreams are at stake.
We want to become doctors, teachers, engineers, and leaders. But if we're not healthy, that might not become true. By passing this bill, you help protect us and give us a chance to achieve our goals. But we need your support to make that happen. Please, pass this tobacco control bill because it's about our lives and it's about our future.
We will stand with these young advocates in their call for action. It is our duty to support them in their future.
Your support for this bill could make a real difference. So let's lead by example as we create a healthy environment for future generations.
Your support for this bill makes a huge difference. Let's take this opportunity to live from the front to set an example to create a healthier future for our generation.
Protect our neck is done now with the presentation. This is the presentation of Protect Our Next. Okay, thank you very much. Honorable members, that technology was very new to us, to some of us, not all. But let me then allow honorable members to interact with the presentation. Raise your hands, honorable members. I'll recognize your hand, starting with Honorable Kumalo. Note your numbers, honorable members. That number 1 is Honorable Kumalo. Number 2 is Honorable Van Staden. Number 3 is Honorable Dr. Litape. Number 4 is Honorable Dr. Carl Leroux. Number 5, Honorable Clark. Number 6, Honorable Shabangu. Number 7, Honorable Mare. Number 7 is Honorable Mare. And then number 8, no number 8 yet. Any member who is struggling to raise his or her hand?
I may be number 8, Chair. My hand was up. I may be number 8. Go.
Right. Okay. Number 8, you are following Honorable Mare. So in this order, honorable members, number 1, Honorable Kumalo, 2, Honorable Van Staden, 3, Honorable Dr. Litape, 4, Honorable Dr. Leroux, 5, Honorable Clark, 6, Honorable Shabangu, 7, Honorable Mare, and 8, Honorable Teko, in that order. Thank you.
Thank you very much, Chairperson. Let me take this opportunity to welcome and appreciate the presentation. Chair, I want just to have some few questions to the presenters. Can they please provide more clarity on the advantages and disadvantages of flavors in electronic cigarettes? Is there any relation between adding flavors and the use of the products by the youth? Secondly, Chair, what are their views on how e-cigarettes are accessed, and what recommendations do they have on how these products should be accessed? Thank you, Chair.
Thank you, Chairperson. Good afternoon. Thank you for your presentation. It was very quite nice to see that you're using the technology to your advantage. Please excuse me, I'm going to switch off my video. My signal is not very good. There we go. I only have 3 questions to you. Actually, only 2. The first one is, would you agree that we need a balanced set of regulations? In other words, do you agree that vaping must be legislated in a separate piece of legislation rather than the bill that is currently before us? And if not, why not? And then my second question is, would you say that smoking tobacco are the main contributors to cancer? And if so, do you have any scientific evidence that can support your views on this matter? That's all for me. Thank you, Chairperson.
Thank you, Chair. And since I've made myself visible, I will switch the video off. My first question is, your motto is talking about protecting the future. My question is, how do we help the present? And I have absolutely no issues with the suggestions about protecting the youth and youth initiation, harm prevention, or harm creation, as you call it. But for those that are already there, that are addicted, that smoke, that contribute to the 2,000 deaths that you quote, that are part of the 12 million that smoke, how can we help them? That's my first primary question. The second issue is about, do you have any suggestions of how we help the youth to make better decisions for themselves? And how do we ensure that they are given truthful information without evangelizing to them, telling them what the reality is out there. The third and last question is a lot of the issues that you raise are about the lack of regulation. And even under the old bill, we could regulate on advertising of the related products. The WHO convention speaks highly about assisting people and preventing them from harm from tobacco smoke. Some of the products don't produce any smoke at all that you talk about. Nicotine pouches, tobacco pouches. But you are not differentiating and you want them dealt with just like the other things that produce secondary smoke. Don't you think there should be differentiation? And please provide why they should be dealt with the same. Thank you, Chair.
Thank you, Chair. Thank you to the presenters. And I think some of your points have been well made. I think particularly around the perspective of we, of course, don't want our youth to start either smoking or vaping. And if you start from breathing fresh air to inhaling a vape, that is a harm compared to fresh air. I do think that it does concern me that the idea of any harm is harm. I think that it's very clear in all kinds of public health approaches that a harm reduction approach is actually important. And so I'd like to hear your comments on the harm reduction aspects of alternative tobacco products. Do you think there is a place for them? And I think particularly in the context of when we look at most societies, there is always a level, even if we try our very best, there is a level of nicotine use in all societies. And how would you propose that we move people from more harmful to less harmful products? So that's the first question. The second question was, I think you put a lot of emphasis on trying to help people sort of prevent not to smoke. What kind of programs do you have? Do you have any programs to help people to stop smoking? Because I think that a lot of your emphasis is on stopping people from being exploited, but how are you creating agency in young people to prevent them from smoking? Is that part of your remit? And thirdly, it would be helpful to know who you as an NGO are funded by. Thank you.
Thank you, Chairperson. I've just got 3 short questions. Some of my questions have been covered. In your view, does vaping have a role to play in getting people to stop smoking? And then how would you suggest that the contents or ingredients of vapes be regulated? What are your views on regulating disposable vapes versus refillable vapes? Thank you.
Thank you, Chairperson. And let us also appreciate the presentation by the young people. And it's very comforting to hear the young people giving such a presentation, which is actually showing that they are standing up against the initiation of young people to smoking, and also working. Their presentation is convincing that they are actually looking at reducing, helping us they helping this bill to reduce the prevalence of smoking. It's really, really appreciated. But I only have one question. What is your take on on this bill in its current form? Do you think it is sufficient enough to prevent initiation? I know that you're talking about young people, which is very great because you are young, you are representing that group. But what is your take on the bill in its current form, and is it going to be sufficient enough to prevent initiation to smoking? Thank you, Chairperson.
Thank you, Chairperson. My question that I would like to ask is that I want to say thank you to these young people for the initiative that they are taking. It is nice to see that young people want to change their lives, because such a lot of things are happening in our communities. Drugs, it's alcohol, it's teenage pregnancies. And here we have a group of young people that say that this bill must go through. I just want to know, what will your organization do to assist young people that is already smoking, that they would like to quit but they can't quit? Um, and I also would like to know, what will your organization do about this illicit trade? Because as you have heard, the illicit trade is a big problem, and that is where the children are getting these cheap cigarettes and tobaccos and things from. And then my last question is, do you think that it is better for children to vape and then to smoke cigarettes? That is the three questions I want to ask, but I also would like to say thank you for a beautiful presentation, and thank you for young people taking initiative in our country. Thank you, Chairperson.
Thank you very much, Chairperson. It is now noisy where I am, but I think I'm audible enough. It's good to hear from the group chair that their focus is on the next. But my advice to them is that it's never too late to protect even the current. I thank the organizations also that continue to support their initiatives to run their campaigns. I will also invite them to schools, to universities, to student villages, and other places of leisure. Because some of our young people smoke or vape because of overexposure, some out of wanting to be smart, and some because of peer pressure. My only question to them would be what their advice is, given the strategy of the industry that targets younger people. Is plain packaging enough so that younger people are not attracted to smoking and vaping? The issue of colors, the issue of tastes, what is their take regarding that? Thank you very much, Chair. Thank you.
Yeah, thank you very much. This bill protect the next, if passed or even before it is passed, we'll need a lot of young people to know about it. What is your role in really continuing beyond just making a presentation to us? But I can gather this from the video clip, video that you showed, that you are on the ground. You continue these programs, or you prepared this video just to be with us? How wide are you in the ground, especially among the young people? Related to what Honorable Pego has asked, we have seen a mushrooming of vape shops in and around institutions of higher learning, and that is a target market, looks like, for the industry. Do you find, are you able to be closer to those institutions yourself to really conscientize so that there's less and less young people who get into this space? Previous presenters have actually indicated that maybe this bill allowing this multiple use vapes machines is probably going to be prohibitive to young people because it's an expensive project to then go into vapes, into the single vapes, because single vapes have got all sorts of things, including environmental unfriendly. What is your view on the single use of vapes? Please respond to these questions from honorable members. and we will take about 10 to 12 minutes from now on, wrap up within that space. Thank you very much.
Okay, thank you for all of the questions. I am here with my colleagues who also did the presentation with me. So I'm just going to give a quick answer to some of the questions before I hand it over to them. Just to, expand a bit in terms of what we do and helping to prevent young people from starting to smoke. Of course, we do have education programs that we do. We go into schools, we educate them. We have school assemblies that we do. We've also integrated, with some of the LO classes as well. But the whole idea here is, of course, teaching them, and everything that we teach them is, of course, backed as well by science and research. As you know, Protect Our Next is a partnership of various different organizations, including organizations that are well versed in the research aspect as well. So everything that we do teach the young people about, of course, is based on facts and research, and we just package it in a way that's easy for them to digest. All right, I'm going to hand over to my colleague now.
Thank you, Kolade. I'll take the questions on the flavors. So when we go to schools as PON, we usually have conversations with the school learners and young people, which we engage with in universities. And one of the main reasons that they cite in terms of starting to use these products or initiation, they usually cite flavors as one of those reasons. They state that it's more appealing, it makes the product seem as it's less harmless, it increases curiosity because of the different flavors. So in other countries, we've seen that they are limiting flavors in order to protect young people from starting these products with the impression that these products are actually less harmless. And then in terms of the accessibility, we do see it as an issue, especially when we see school kids smoking or having access to these products. And one of the main type that they use, it's the disposable vapes. So again, in other countries, they are banning disposable vapes because they are much cheaper and it increases accessibility among young people. And then the issue of the bill separating e-cigarettes and other tobacco products, we believe that this bill already separates the different products. If we look at packaging and marketing, it does differentiate the products. And then moving people from harm to less harm, we believe that it should be done in a controlled manner. It should be not accessible to even non-smokers or never smokers. And I believe that we shouldn't be encouraging people to switch. We should be encouraging people to quit instead. Because when you're switching, it means you're basically switching how you intake your nicotine. And then when you keep quitting, you're completely quitting or ending a nicotine addiction, which is a chronic illness according to DSM-5. So I believe that we need to encourage people to quit smoking and quit nicotine dependency. And the proposed bill, the proposed measures in this bill will help those who are addicted in quitting. So, for example, the graphic health warnings will help them, have a better understanding of the health harms of these products. So also the 100% smoke-free ban, it will decrease the social acceptability and normalization of these products, which will motivate smokers to stop smoking altogether. I'll now pass over to my colleague.
Okay, thank you so much, Sintle. So I will be answering the questions on what current cessation programs do we have? So the current cessation programs that we have include nicotine replacement therapies. We also have counseling. These programs would need to be strengthened in order for them to be better managed and coordinated. And in terms of assisting the current smokers, we also have the National Council Against Smoking, which has a quit line, and also Cancer also has an online e-kick buds program. So in terms of young people do need to be educated. Young people do need to be informed of what it is that they or what it is that is presented to them. So, as my colleague had already mentioned, young people need to be provided with scientific evidence to show that this is what they'll be ingesting and this is what has been presented to them. Thank you so much.
I'll take it. I'll take it.
Okay. The young people are done now.
Good afternoon, everyone. Good afternoon to the chair and everyone present online. I am going to speak or comment on the harm reduction aspect and the differentiation of products. So we've been asked to give comments on harm reduction products and basically how we propose that people move from harmful to less harmful products. But first of all, I'd like to basically touch on the fact that harm reduction is only applicable if we can see that it legitimately reduces the risks of, health risks, especially to young people. So if we're going to move people from using tobacco to nicotine, it doesn't necessarily create less harm for them if it's still going to lead to lung cancer, cardiovascular, and respiratory problems for our future generations. This is moving from tobacco to nicotine products like snuff, vapes is an alternative, but at the end of the day, it still creates a lot of harm for people, especially if it affects their most vital parts of their bodies. We don't want to have a future of people who are asthmatic or they can't even partake in cardiovascular exercises or sports for their own benefit simply because we have exposed them to less harmful products in the name of reducing harm. Because evidently, according to the stats, youth uptake is increasing, and this shows that not only are adults resorting to less harmful products, but youth is beginning to take up more of these products, even people. So it creates a question of, is this really harm reduction or harm creation? So I believe that all these products should fall within the bill. They should be treated the same because ultimately they create risk and health risks for everyone.
Right. Okay.
I believe we've answered most of the questions. But yes, just again, to reiterate, because I believe this is very important, is we do, of course, believe in of course, being on the ground and educating young people and always finding ways that's very impactful for them, speaking sort of in the language of young people. But all of the work that we do will be nullified if we don't have the right legislative environment to actually help to protect young people from starting to smoke. So yeah, that's just the most important thing. And also just to clarify, we aren't an NGO. We are a partnership of organizations, and we're funded by various different organizations within that partnership.
Okay. Thank you very much. We appreciate your contribution. It will add on to the voice of other stakeholders, including the young people who have come to us to share their contribution to us. Thank you very much. You are actually speaking on behalf of young people, hence you are keen on what is going to be for the older people, but that's fine. We can't hold you for that one. Thank you very much. The next presentation that we are going to listen, honorable members, is from the economic freedom fighters. Can you give them sharing rights? They will be starting in the next 2 minutes, and they will finish just 2 minutes before 5:30. If we could then give the honorable, no, yes, 5:25. Thank you very much. Honorable member, whoever is presenting from the economic freedom fighters, you have a floor. Ms. Machalamba, have you given them a sharing rights?
I'm still trying to get hold of them, Chair. They are not on the platform. And can I request that if they are not ready, we ask Philip Morris to present if they are on the platform?
I am here. Sorry for interjecting, Chair. I'm here. I haven't been given sharing rights.
Who is here? Is that
Hello,
Philip Morris
hello.
or EFF? It says the user, so I don't know who the user is.
Well, this is
Yeah.
Luabala. I don't know.
Okay.
Yeah.
All right.
Can you start by renaming your gadget for our records? We need to know who's the user. Is it Shomo or is it Kumalo? Would you be able to do that?
I'm trying to do so, Chair. I'm using a new gadget. I was just unaware that it shows me as a user.
I'll rechange it. I'll rename it for you. Thank you. You can start
Please
sharing.
do. Sure.
Okay, we'll now stay with Mr. User for now until you introduce yourself and tell us who you are. You can start. Thanks.
Thank you, Chairperson. Am I audible?
Well audible, yes.
Thank you so much, and I'm grateful for Mr. Majalamba for turning me from user to Luabalo.
Yes,
Chairperson, firstly, as the Economic Freedom Fighters would like to thank Parliament and the committee for giving us this opportunity to come make this presentation here. I must firstly apologize for the fact that I am in deep rural areas and my network is very unstable. So may I kindly request that I disable the video to enable me to be more audible here.
Agreed. Thank you.
Thank you. We are truly honored to be here, and while we know that you are fully represented in Parliament, we thought that because of the importance of this bill, both for the health and socio-economic impacts of tobacco in society, it would be prudent for us to come make this presentation here. This is so because we acknowledge that the proliferation of the habit of smoking amongst all sectors in society has a very deep and deleterious impact on the health and the economy of this country. We know from studies done in this country, in the continent, and in the world that smoking is one of the major causes of non-communicable diseases. There's a recent study by a lady called Zunda Chisa here at the University of Cape Town, which found, amongst other things, that tobacco spending diverts resources from essential needs, particularly education, housing, transport, and household goods, posing severe challenges for lower income households. Similarly, the study re-emphasized findings that have been made by numerous other studies in relation to the health complications of smoking in this country. It emphasized issues that are well known, like the fact that tobacco or smoking harms all vital organs of the human body, leading to all known types of cancers. And that in 2021, there were about 32,000 people who died due to tobacco-related illnesses in South Africa. And these and other studies as well estimate that tobacco use increases the risk of coronary heart diseases and stroke by 2 to 4 times, and lung cancer by 25 times. So these health risks we allude to here, combined with the economic costs of treating people who fall sick as a result of smoking, is devastating to both our economy and to the health system as a whole. And as a result, then we applaud the introduction of this bill as a means of trying to legislate the use and sale of tobacco in the country. Well, this would be like preaching to the converted. We know that the current legislative framework is Act 83 of 1993, which provides, in fact, for some restrictions in smoking, packaging, and labeling of tobacco products and advertising and sponsorship. It is through this bill then that all of these regulations and restrictions relating to tobacco have been issued. So we know that this bill will repeal the Act 83 of 1993 and introduce a new legal mechanism, including the introduction of electronic delivery systems as part of tobacco products that will now be regulated. And a factor we both applaud and are cautious about, and I think that will be clear as this presentation proceeds. In terms of the bill itself, we are in support of the definitions in clause 1 of the bill, and we think those are comprehensive enough to cater for a whole range of products that are proliferating in society. So we are particularly in support of the definitions in clause 1 of the bill. We are further in support of the whole range of restrictions introduced by clause 2 of the bill, like the outlawing of smoking in enclosed spaces, be these in public or spaces or workplaces, and the prohibition of smoking in areas used for conveyancing of people. We know that in our taxi ranks, train stations, a whole lot of people who don't smoke get exposed to secondary impacts of smoking there. The clause also prohibits smoking in public transportation system and even in private vehicles where a non-smoker is present. We think that is essential in order to drive the message that people who want to smoke must do so without necessarily impacting the rights of those who don't want to smoke to be exposed to smoking. We are also fully in support of the provision that owners of public spaces or people in charge of these spaces must have the responsibility of ensuring that people who don't want to smoke do not get exposed to smoking. We are thinking here specifically about pubs and areas that young people go to for entertainment, that even though they may go there for entertainment, a good number of them do not smoke, and that they get exposed to these secondary impacts of smoking by virtue of being in these places. So we support that. Um, we are further in support of Clause 3 of the bill, particularly the section that seeks to restrict communication amongst manufacturers themselves, manufacturers of tobacco products and other trade partners. That limits this communication to only communication that relates to the characteristics of the products, but not to the marketing of these products. I think this is crucial as well, and I think the institutions or bodies that this bill seeks to create will be vigilant in ensuring that there are no loopholes in terms of these manufacturers not marketing these tobacco products by other means. We are, and I think this is the most important aspect part of the bill for us, the restriction which prohibits retailers from displaying tobacco products. We know that in terms of this provision, the retailers must not display tobacco products, and that people who want to buy these tobacco products would be referred to a list of the products that these retailers have. So we are particularly happy with that provision. And I think it seeks to re-emphasize the entire purpose of the bill in terms of ensuring that we do not, as a society, promote smoking in whatever way possible. And the display of these tobacco products at retail spaces would even have an element of promoting these products, even though the overt advertisement of tobacco products was banned. So we are particularly happy with that. I think it is central to our support of this bill. So further, and this is where we have a bit of a problem with the bill, Chair. Clauses 4, 5, 6, and 7 make provision for standardized packaging of tobacco products and give the minister authority to develop regulations that would prescribe a set of requirements. So we are fully in support with standardized packaging of tobacco products. We don't have a problem with that. We support those provisions. Where we have a bit of a concern is in as far as these clauses defer most of the legislative work that would need to be done in this regard to the minister in the form of giving him or her powers to make regulations. We know this is not unusual in law, but I think because of the serious nature of the beast we are dealing with here, these provisions ought to have been outlined in the primary legislation itself and not to the minister via regulations. So that may be the only challenge we have with the bill as the EFF at the moment. Because the bill will have long-lasting effects on the industry, and time must have been taken to conduct thorough research on the kind of regulatory framework needed to attain the same goals that this bill seeks to achieve, and that those considerations ought to have been included in the primary legislation itself, not to be deferred to the minister to make regulations. So in the end, Chairperson, the bill seeks to address the debilitating effects of smoking, both on health and in society and in the economy. We acknowledge that it goes beyond measures that were previously in place in as far as restricting the sale and advertisement of tobacco and related products. We acknowledge the inclusion of electronic nicotine delivery systems and electronic non-nicotine delivery systems in the bill. We support that. However, we are not convinced that thorough research has been undertaken as to the health effects of these electronic delivery systems in South Africa. We do not know as yet how much of an effect on health this has, whether it's the same or worse than your normal tobacco products. So we have that concern in as far as that is concerned. But broadly, the EFF is in support of the provisions of the bill in relation to the control of smoking, the restriction of sale of tobacco products, and the provisions not to display tobacco products in shops, but we have a list of these products made available to customers on request. As indicated previously, the leaving of some of the most fundamental aspects of the purpose of the bill to secondary legislation is a concern to us. And these are listed, I think, particularly in clause 15. I think these are quite comprehensive and a lot. And I think they should have included in the bill itself, as indicated earlier. It is regulation heavy, and that's not ideal. And again, on the question of these systems, electronic nicotine and non-nicotine delivery systems, we are not clear on the basis of what research are these products included in the bill. I think more work ought to have gone into that area. But in conclusion, then, Chairperson, this is a critically important legislative intervention aimed at addressing these very serious problems in the country. We know from scientific research that there is a direct correlation between aggressive advertisement of these tobacco products and the increased rate of smoking, and that in fact tighter controls on the advertisement of tobacco products may have an effect of lowering the rate of smoking, or at least the rate of new entries into the smoking in the industry. So in that respect, then this legislative intervention is very important to address both the health and economic impacts of smoking in this country. Save for the concerns we just highlighted in the presentation, the EFF would support the bill. Thank you very much, Chairperson. Am I still here?
Yes, you are.
Okay.
Oh, yes, Baba, I was trying to check. Was that your last slide?
It was, Chairperson.
Okay. Yeah, no, I noticed that. I just took a little longer. Honorable members, I'm just trying to move away from this noisy mall. But so long I'll be able to recognize your names. If you can raise your hands on the platform, thank you very much. Honorable Kumalo, number 1. Honorable Dr. Letape, number 2. Honorable Clark, number 3. Honorable Leroux, number 4. Honorable Spine, number 5. In that order, honorable members. Yeah, let's start again. Honorable Kumalo, you're number 1. Honorable Dr. Letape, you're number 2. Honorable Michelle Clark, number 3. Honorable Dr. Leroux, number 4. Honorable Sine, number 5. Any other member I'm leaving out?
I don't know what's happening to my gadget, Chair, but I am able to raise a hand on my side. I
Okay,
think
you are
I will
number
be number 6. Yes, Chair.
Also myself, Chair.
Honorable Mutubase, you are number 7. Thank you. In that order, honorable members start.
Thank you very much, Chair. Let me take this opportunity, Chairperson, to welcome and appreciate the presentation by the EFF. Chair, I note that the EFF is in support of Clause 2 of the bill, which makes provisions for restrictions on smoking. I'm happy that you recognize the harms caused by exposure to others people's smoke through whichever products. Why do you think this is important for the low-income workers in the country? Thank you, Chair.
Thank you, Chair. My questions are just specific to two issues. On the issue of public spaces, would the EFF support a position where owners of establishment are free to choose whether their places are smoking places or not, so that those that choose not to smoke should know where not to go, and people that smoke may know where to go? Would that be allowed so that there could be protection but acknowledgement of the rights of others? The second question comes to the confusing point where you should provide clarity, where you're talking about the bill having too much regulations and that should be left to parliamentarians to do. My understanding was it shouldn't be either. Parliament provides the law, and the details would be in regulation, which should not be in the law, and that should be under the jurisdiction of the minister, because that's where changes occur. Because otherwise, when we have a new product category that is not covered, it then means we have to change the law to cover that category. So we need to be writing it broadly in reverse, that as MPs, we make the law that is broad enough to cover us into the future, and the regulations are left to the ministry to come up with regulations that it be specific on certain issues, so that if it needs to change, it's much easier to keep tweaking regulations than to keep amending legislation. Thank you, Chair.
Thank you. Thank you, Chair. I knew it was me. I just couldn't get my camera on. Okay. Thank you for the presentation. If you could just tell me, what is your view on how illicit trading is currently policed, and how would you suggest that this be improved? Because as you know, it's a huge problem we're having to deal with, and that is something we need to get a handle on in terms of this bill. And then what would you consider legitimate harmless products? From the presentations received so far, it does not seem that there are harmless products, only products that cause reduced harm. And what are your views on regulating disposable vapes versus refillable vapes? Thank you.
Thank you very much, Chairperson. Please allow me not to switch on my video.
Honorable Leroux.
Thank you. Thank you, Chair. And
Thank you for the presentation, EFF. My first question.
Honorable Sine will take you after Honorable Leroux.
Oh, I thought it's me, Chair.
thank you, Chair. And thank you to the presenter from the EFF. I just had one question. I'm interested to find out and see that you are so strongly in support of display bans and in so strongly in support of plain packaging, because one of the very interesting presentations that we had was from informal traders and tavern owners in the townships who said that these measures will be devastating to them and their business and might make them go under. So I was just wondering why you are in support of that when it is going to affect poor Black South Africans who are trying to make a living, according to them, quite significantly. Thank you.
Thank you, Chairperson. And let me also appreciate the presentation by Economic Freedom Front. My first question is on slide 12. You indicated that the rest of the clauses seem to defer most of the legislative work to the minister in the form of giving the minister powers to make regulations, and that provisions ought to be outlined in the primary legislation itself and not to the minister via regulations. Are you aware that regulations are subordinate legislation to the ministers? Is this not an executive authority conferred by the Constitution and Act of Parliament to the members of the National Executive? And my second question, Chair, from slide 11 and 12, the presenter indicated that with regard to nicotine delivery systems, it's not clear on the basis of what research these products are included in the bill for restriction of sales and use. You further said that the provisions must not hinder legitimate, harmless products that also contribute to the economy. How did you arrive at the notion that these products also, based on the information gathered from the previous presenters, can you still say they are harmless? And interestingly, for tobacco products, not the newer products like 4, and also on a conclusion, you seem to agree that tobacco and smoking has an impact on health and the economy. And this legislation intervention is important to address both the health and economic impact of smoking in the country. You seem to have two contradictory statements on the economic issues and also, so can you please make it clear the nicotine ones are harmless and only the traditional ones are harmful? Thank you, Chairperson.
Well, thanks very much, Chair, for the opportunity, and thanks for the presentation. What would you suggest that we do regarding the causal factors? Would you agree with me that the introduction of many legislations, in fact, doesn't assist, but the causal factors that are socio-economic are the issues that we should by right be targeting, and deal with those issues, because young people, as they are unemployed, they will enter into these habits, not by their own liking, but because they're not occupied. Would you agree with me that banning is not the solution in this instance, because we have gone too far in the journey, too deep, but we rather coerce and try and promote a lifestyle or a habit that will move away from what we have now. But what we need to do is to go deeper into the socio-economic situation. Do you believe on harm is harm? And thirdly, what would be the programs that you'd suggest that we must carry forward to try and help young people, because we are focusing too much on young people, to move out of the current morass that we find ourselves in? Thank you, Chairperson.
Thank you, Chairperson. Let me join the colleagues in appreciating the presentation from the EFF. Let me also appreciate the support they are giving to the bill. I think there is interest amongst young and younger persons
regarding this bill, meaning that they have interest in protecting themselves and also those that they are representing. Chair, regarding the presentation, it looks that they are in support of most of the clauses, but not the bill in its entirety in its current form. I would suggest that if in the presentation there are suggestions that they have put forward, we look as a committee in those in that submission and look in to the areas where they are raising concerns. Not now, but at a later time, we look at those suggestions and see if they are assisting the move. What we need is ultimately a smoke-free South Africa. Thank you very much, Chair.
We appreciate the presentation, and we really are grateful to you, Mr. Lubabalo, for taking time from mandated by your party to come and make a presentation. I think it's highly recorded and well recorded, recommended that in this portfolio committee there has been a formal presentation of a political party, let alone that you are fully represented here. And we now can even glean from this presentation what will be the mandate of your members in this portfolio committee. So one is welcoming some of the things you are raising, that you were probably not very much well versed. In fact, just to share with you, this bill is, among other things, strengthening the tobacco products that we already have in the country. But there's a whole host of other things that are to be regulated that were not there covered in the current act of that is in the country on tobacco. So hence the introduction of these other electronic systems. I hear in your presentation that that is not your strongest point of understanding these issues, and you probably think they should have been regulated somewhere else. The challenge with that, which we need to share, we have to get all of them regulated immediately. Some of the people who wanted them dysregulated even long time than this. The only thing that this bill is probably going to take into consideration your concerns is to have a differentiation of statements. What is it that we are talking about when we are talking about cigarettes? How do we regulate the hookahs? How do we regulate the vapors? How do we regulate the nicotine pouches and all that? So it has to come all of it under one basket. Otherwise, if we were to do one by one, we'll have too many eggs. But all over the world, they actually put them under one basket. That's one other issue that we would want to really raise with yourself. But just to check, how quickly would you want to see this bill being effected as an act in our country? Let us give you the comments and asking and clarity seeking questions to raise, Mr. Lubabalo. Thank you very much. You would have about 10 minutes to respond. So around 22:06, yes, we'll ask you to pause and stop. Thank you.
Thank you, Chairperson. I hope to take far less than the 10 minutes you've so generously granted me. But Chairperson, perhaps before I dive into the replies, I need to state that I just could not hear what Honorable I think it's Sene, was saying. I don't know whether the problem was with her network or mine, but I struggled to hear most of her input. Be that as it may, then, Chairperson, perhaps starting with your concerns here and moving backwards, I don't want to be misunderstood as having said that we want these electronic systems to be regulated under a different act. The only input we made in relation to that was that I was not convinced as to the research that went into the inclusion of these systems here. If there is research that perhaps we have not been made peer review to, proving the harm caused by these systems, then by all means we support their inclusion here. We are not saying that they should be regulated elsewhere. So that's the correction I just wanted to make, Chairperson. Secondly, well, the regulation of these products is quite urgent. So the sooner the bill gets enacted into law, the better. And the sooner our institutions are empowered to deal or to handle the kind of regulatory responsibilities they would be given once this bill is enacted into law, the better. So I think it is an urgent legislative intervention that needs to be made. That notwithstanding, and this relates to the question, I think I registered the name as Honorable Moshamane. I'm not sure if I captured the name correctly. I fully agree with you that there is no piece of legislation that is going to address all the problems we have in society. There needs to be a whole spectrum of interventions made to dissuade young and old from smoking. And I think the deleterious effects of smoking in society are so grave that perhaps it may warrant an intervention similar to that which was taken by government at the height of the HIV crisis. The educational programs that were unleashed in schools, in churches, in villages, everywhere, to just conscientize people about the dangers of smoking. Because I think merely having a warning in the packaging of these products may not be enough without a much more clearer and explicit demonstration of the harm caused by these products on the health of society as a whole. So I agree with you fully about the need for a much more broader societal intervention at the level of young people specifically, but at the level of everyone who smokes in this country. There was a question, I think this is the little bit I got to hear from Honorable Sene, but I know there was someone else as well who asked a question regarding the concern we have with regulations. We are not opposed to regulations per se because we understand that regulations are part of the legislative process. They are secondary legislation. But if you just look at, I think it's clause 15 of the bill, about just how wide these powers for making regulations are and how wide the specific interventions are. And I am not convinced that those all of those require the kind of regulation that the view that the bill proposes. Some of these could easily have been integrated into the primary legislation itself, because some of these interventions are not going to change in the next year or 2 or 5 or 10. For instance, that would be, for instance, the need for the distance I think the very first clause, the 15(1)(a), the distance within which smoking is prohibited from an operable window. I don't think there's going to be a scientific evidence that changes those things. So I think some of these issues ought to have been integrated in legislation itself, because what the corollary of these regulations is that we may be in a permanent state of we may give the minister a permanent role of legislating and re-legislating through regulations. So that's the only concern we had. In terms of the question asked by Honorable Leroux on the impacts that a complete ban on display would have on small businesses who depend on selling of these tobacco products. Well, I think we'd have to contrast that with the devastating effect that smoking has on health and in the economy generally, and also reconcile ourselves with the fact that when the initial bans on advertising of tobacco products was enacted, people who wanted to smoke still continued smoking. So it's people who just have to adjust. You know, if as the bill provides that these are retailers who must just display the list of products they have, people who want to smoke would still go smoke. But I think what this bill would have is to take away the incentive. It would disincentivize new entries into the smoking field, because these products are not there in their faces all the time when they go into these retail spaces. So we would like, I think, we would support that in as far as it would have a dissuading effect on youth entrance into smoking. So I don't think there's been any credible research made available to this committee to the effect of the number of jobs that would be lost as a result of this, and what can be done to prevent such a loss of jobs. And that also relates to the question, I think it was Honorable Clark, on illicit trade. There are two interrelated but still distinct factors here. The first one is the impact of smoking on health and in society generally. And the second one is the proliferation of criminal activity going on. And in relation to the second part, that largely is a law enforcement competency that I think needs to be done. Right now, at the moment, there is no ban on the sale or advertisement of liquor products in the country, but townships or rural areas are awash with illicit liquor that is manufactured elsewhere. So that points to a problem of weak law enforcement that we would have to address. And I don't think there is any correlation between banning the advertisement of tobacco products with the increase in illicit products, because those products are currently here right now without the provisions of this bill being in effect. Honorable Prof. Letlape, I just didn't record uh, his points clearly here, Chairperson. I would apologize for that. I didn't record the points that he made clearly. But that would be the end then of my reply, Chairperson. Unless you want Honorable Letlapo to quickly restate the question. Am I alone or are there people?
Honorable Mr. Lubabalo, he will write back to you and you'll write back to us. Okay. You will get that from Ms. Machalamba, but the session now was for you to respond. You will still help us with your response by writing back the questions once they are received by you back to us. Okay.
That's fair, Doc.
Yeah. Was that your last comment on Dr. Letape?
It was, Doc.
Yeah. Once more, we'd like to take this opportunity to thank you for taking time to come and present to this portfolio committee and share with us what is your party's contribution to this bill, and then we will try and do and work with the speed that you probably have indicated and wrap up. Hopefully members will go the way you are suggesting, but if also it does not go the way you are suggesting, we'll take it from there. But thanks very much for your contribution, and you are released. But you could stay also for the next presentation, which is coming in immediately after yourself. Thanks. Right. Honorable members, after the presentation of Mr. Lubabalo, we're taking the last presentation from called Phillip Morris. Phillip Morris is going to make a presentation from now until about 6:10. And thereafter, Phillip Morris, you will interact with us by question and answer. You first take pen and paper and get all the questions, and then you respond to them, and then we'll give you another 10 minutes thereafter to close. Your 10 minutes starts now. Your 30 minutes starts now. Introduce yourself and the work that you are bringing to us. Thank you very much.
Thank you very much, Chairperson. Good evening, Chair, and all committee members. I greet you all. We are Phillip Morris, South Africa. My name is Buhle Binda. I'm the head of scientific engagement for Sub-Saharan Africa. I'm not alone. I'm joined by my colleague, Mr. Themba Matubula, who is the Director of External Affairs in Southern Africa. I would like to share with the committee that Themba and I are no strangers to the implementation of public policy and regulations, with I having previously held scientific and regulatory positions at the National Health Laboratory Service, the Department of Health, and our Health Products Regulatory Authority. And Themba has had leading roles in telecommunications, financial services, and the public health sector to shape policies that will help our nation. So we greatly appreciate this opportunity, Chair and committee members, to present our submission on the proposed bill. We had made a submission in 2023. As members of the committee, as we go through our agenda, I would like to highlight that we will not present on the concerning challenge of illicit trade, as it has been touched on extensively by various stakeholders. And we believe that the committee has taken note of this concern, and we have confidence that you will consider proposals previously made by previous speakers when you conduct your deliberations. Now, as we go through the agenda, several experts on this platform have highlighted the need for the adoption of harm reduction strategies based on scientific evidence. And it is on this basis that I'll be sharing the latest scientific evidence on tobacco and nicotine-containing alternatives, which we'll refer to as smoke-free products going forth. And Themba will be outlining the latest regulatory and international policy best practices. Thank you. Over to you, Themba.
Thank you, Buhle, and good evening, honorable members of the committee. Chair, before I start, let me take this opportunity to thank the committee secretary, Ms. Vuyokazi Machalamba, for selflessly coordinating this program. As Phillip Morris, South Africa, we send our sincere appreciation. Now, honorable members, as Phillip Morris, we fully support a regulated nicotine market in South Africa. Let me start by highlighting these few principles which we live by. and that is those who are underage and adults who do not smoke or use any nicotine products should not start experimenting. Of course, the best choice a smoker can make for their health is to quit altogether. However, we appreciate from evidence that not everyone does. So the next best option for those who do not quit is to change. And we believe they need to be supported to switch to scientifically proven reduced risk products. This is not just a fancy slogan, but it's a central part of our vision of a smoke-free future. As Philip Morris, we are committed to replace every harmful combustible product with a less harmful alternative and contribute to accelerate the end of smoking cigarettes. We are a South African company that is headquartered here in the Western Cape, Cape Town. We do have several offices across the country. We also have a manufacturing facility in Gauteng, Boksburg, and we use this for other tobacco products such as snuff. Chair and honorable members, we are participating in this process as a legally compliant South African business that contributes to creating economic value in this country. Once again, we appreciate the opportunity to share with you our views on the bill, which are relevant to our operations in South Africa. We are part of the global Philip Morris International family, where collectively we are driving our 2030 vision of a smoke-free future. We have committed and we want to make cigarettes obsolete. We have invested billions behind this vision, developing scientifically proven products and making them accessible in 97 markets, including South Africa. Of late, we estimate that about 41 million adults are now using our smoke-free products, and a significant number of them have abandoned cigarettes completely and switched to our heated tobacco products. As Philip Morris, we believe that this bill should be an opportunity for South Africa to accelerate the reduction in smoking prevalence. The World Health Organization estimates that more than 1 billion people globally will continue to smoke in the foreseeable future. Locally in South Africa, the estimate is that around 11.1 million smokers are using tobacco or cigarettes. Now, this is a very high number to ignore, whichever way we look at it. And we know that tobacco control measures alone will not be sufficient to reduce smoking prevalence as rapidly as we all anticipate. We therefore see an opportunity for a complementary approach where adult smokers who would otherwise continue to smoke are supported to switch to less harmful alternatives. The reality is that, honorable members, when South African smokers are encouraged to switch in their numbers, we will see an accelerated reduction in smoking prevalence, and this will go directly to the heart of the bill's objective, which is to reduce the prevalence of tobacco use and nicotine dependence. Now, let me take this moment and emphasize that no tobacco or nicotine product is risk-free. As you can see, these products exist on a spectrum of risk, and they range from the highest risk to the lowest health impact. Combustible products, starting with cigarettes on the left, they present 100% risk. Smoke-free products on the other side, they do not combust and have been proven scientifically to present a significant low risk. So essentially, you have two product categories, and that is combustibles, the products that burn tobacco, like cigarettes and others, and then you've got non-combustibles, and these are products that include heated tobacco, e-cigarettes, and oral nicotine pouches. And we'll share the evidence on these products a bit later on. Now, on this evidence alone, an inclusive policy approach would recognize this scientific fact and adopts a risk proportionate regulation than seeking to equalize the treatment of these products, which are clearly distinguishable. The risk continuum of these products has never been invalidated. Therefore, the assertion that harm is not supported by science and is devoid of evidence. Allow me to invite Buhle back to share more on the science and evidence of the smoke-free product.
Thank you, Temba. Members of the committee, as I'll be taking you through the overwhelming science on these smoke-free products accumulated over time, I would like to touch on nicotine, as all these products contain nicotine, and there's been a lot of misinformation around it, because for the longest time, smoking cigarettes was the only way an adult smoker could consume it. As shared by Professor Michael Russell in 1976, who was a psychiatrist who understood addiction, people smoke for the nicotine, but they die from the tar. So what is nicotine? Simply put, it's a substance produced by the tobacco plant that belongs to the nightshade family of plants. That is the nicotine that is contained in our smoke-free products. But what is important to highlight is that various public health bodies around the world have recognized that nicotine is not a carcinogen, so it is not a cancer-causing agent. And most importantly, it is not the primary cause of smoking-related diseases. What causes harm to smokers is the high levels of toxicants produced during combustion. We're talking over 6,000 chemicals and about 100 of those being linked to smoking-related diseases when you burn a cigarette. So smoke-free products such as your heated tobacco products, your e-cigarettes, and your nicotine pouches do not combust. There is no burning, so there is no smoke or tar released. And they deliver nicotine to the adult consumer in a less harmful manner. And hence, there's a need to regulate them differently. As I will be taking you through the mounting science evidence on smoke-free products, I would like to highlight and respectively remind all members that 2 weeks ago on this very platform before the committee, the World Health Organization mentioned that they are not against harm reduction. And they mentioned that strategies for harm reduction should be informed by science. So let's look at the science on smoke-free products as shared by credible public health authorities around the world. On the screen, we have our category of smoke-free products. Heated tobacco products and e-cigarettes are inhalables, which heat tobacco or nicotine, releasing an aerosol. These products are available in South Africa. We also have oral smokeless products such as snus and nicotine pouches, with nicotine pouches also being available in South Africa. So right, in 2017, the US FDA, which is the Food and Drug Administration, which is no stranger to South Africa in the regulatory space, they announced a comprehensive plan for these products with the goal of, and I quote, striking the balance between regulation and encouraging the development of innovative tobacco products that are less dangerous than cigarettes. So in subsequent years to this announcement, we have submitted scientific evidence to the FDA for review and assessment. And following their rigorous assessment process of the evidence brought before them, they have come out and made the bold statements listed below, with the authorization of nicotine pouches as recent as January 2025, because they believe that there is sufficient evidence that shows that the benefits outweigh the risks for smokers who switch to these smoke-free products. However, it's not just the US FDA that has assessed and endorsed the science behind these products. Let's look at other public health authorities around the world. Since the year 2008, we have conducted extensive research studies on our portfolio of smoke-free products. But focusing on our heated tobacco products for now, to date, we have published over 500 scientific publications on heated tobacco products, and these publications are publicly available. I would just like to share one of the compelling findings that we have. Our scientific assessments of our heated tobacco products have shown that by removing the process of combustion, the aerosol produced by our products contains 90 to 95% lower levels of harmful chemicals than in cigarette smoke. I remind you of previous presentations of experts on this platform indicating that the levels of toxicants in these products are drastically reduced and that sometimes at levels that are unquantifiable. These findings are not unique to us only. There are over 750 independent researchers who have published publications on heated tobacco products that support our evidence. And I feel that it is important to highlight that to date, 11 government agencies around the world have concurred on these findings. I would also like to mention to the committee that it's important to note that none of the studies on our heated tobacco products have been disproved, and we remain open to research collaborations on our products. And as we move on to the next category of products, we look at e-cigarettes, which are sometimes referred to as vapes. And since 2014, Public Health England, which has since changed its name, has conducted several scientific reviews on e-cigarettes, updating and expanding the evidence on these products. Their conclusions across all their reports are that e-cigarettes are significantly less harmful to health than smoking and can positively impact public health. In 2015, they stated that the current estimate is that e-cigarettes are around 95% less harmful than smoking cigarettes. I've also shared a snippet on my slide on the myths and facts on vapes from the National Health Service's website in the UK. One other myth I thought would be great to share is that they said that exposure to the vape aerosol is harmful to the people around you. They debunk this myth. They say there is no evidence of that. If there's any risk at all, it is very likely to be low. Now, as we look at our last category of products,
Hello, let me alert you, you are on slide number 11 of the 29 slides that you have. You are halfway through your time.
Noted, Chair. Thank you, Chair, very much for that. We are monitoring the time. Thank you, Chair. So let's look at our oral smokeless products, snus and nicotine pouches. Snus contains tobacco in a pouch, and nicotine pouches have since evolved from snus, and they do not contain tobacco. So just a bit on snus. Snus has been used in Sweden for decades, and to a large extent, it has replaced cigarettes, especially amongst male tobacco users. This has contributed to internationally record low rates of smoking and smoking-related diseases in Sweden. And scientific literature shows that snus does not encourage people to start smoking. In fact, they are more likely to stop smoking cigarettes. The German Federal Institute in Germany has conducted a health assessment on nicotine pouches, and their assessment included experimental research. And they wrote that switching from nicotine pouches could represent a reduction in risk for the person who does switch. So this concludes my section on the scientific evidence that has been demonstrated and assessed by independent health bodies. However, Chair, before I hand over to Themba, as I conclude, members of the committee, as we embark on the journey of collating local research to make conclusive statements and inform our policies for South Africa, let us recognize the overwhelming amount of global scientific evidence and rely on it to inform our health policies. In efforts to accelerate reductions in smoking prevalence, let us keep in mind that we know the best choice is to quit smoking altogether, but not everybody does. So let us adopt a harm reduction approach supported by risk proportionate regulation. I would like to hand over to Themba to take us through on how, for the first time in South Africa, we can adopt tobacco harm reduction. Themba.
Thank you, Bushe. Indeed, honorable members, we believe that a tobacco harm reduction approach can significantly benefit our country's public health. The bill can take lessons from our own South African successes, where harm reduction was fully embraced to benefit public health. So in this country, we know that harm reduction saves lives. What we are looking at, most of you will remember, South Africa was at the forefront in the battle against HIV/AIDS, and the ABC campaign, in my view, including giving PrEP treatment to sex workers and medical male circumcision drives, are one of the best examples that show an integrated harm reduction approach in public health. Now, I was personally involved on the ground, pushing these initiatives, traveling towns and rural parts of the country, also in Lesotho and Eswatini, supporting the implementation of government PEPFAR programs in the region. We met people where they were. We gave them options. We gave them tools. And most of all, we gave them choice. It was not imposing a single pathway, which this bill, if left unchanged, it will promote. The quit or die approach has not been proven to be effective, and we know it will not work. So South Africa also joined the world and embraced the needle exchange program to support drug users. Some of you honorable members will remember, we had to be brave in the face of criticism. We did this to save lives. Some criticized government of encouraging underage sex and stimulating youth to be sexually active when providing sex education and awareness drives. Others said that helping sex workers was going to fuel GBV and legitimize the trade. But none of this counted. We were guided by evidence. We knew better that these measures were adequate for the greater benefit of the population. So I say we've been here before. Criticism of harm reduction is not new. Let us embrace the robust evidence that is available and apply the same approach to tobacco. Without a doubt, smoke-free products can give smokers a fighting chance, not just to survive, but to quit smoking for good. Let me indicate, honorable members, our critique of the bill comes from a good place to ensure that the fatal flaws are addressed. We want South Africa to have a bill that is comprehensive and balanced. The key challenges in this bill can be grouped into two themes in our view. One is the issue of rationality. For example, seeking to regulate empirically different products the same way is not rational. Also, ignoring evidence of the different risks and benefits that are presented by smoke-free products is not rational. It is highly irrational to embrace a theory than robust scientific evidence to make a policy determination. We were told several times that harm is harm, and I hope by now the committee will appreciate that such a statement does not have a place in policy making, especially in public health, whose core mandate is to reduce harms at the individual and population level. The second issue relates to what we call unjustifiable limitations. These mainly relate to consumers' rights to access to information so that they are able to make informed choices, as well as the right to commercial speech. Now, what do we propose to strengthen the bill? 3 points that we want to put forward to the committee. The first one is that the bill needs to be comprehensive to ensure that all products that are in the market are covered. Oral nicotine pouches are currently excluded, and we provide a few sections where they can be brought into scope. The second point is around harm reduction. We need a harm reduction strategy to complement tobacco control measures. Harm reduction and tobacco control measures are not enemies. They are complementary, and they've been proven to work elsewhere. And the third point is we propose that this bill needs to embed a risk proportionate regulatory framework to ensure more stringent measures for the most harmful combustible products while ensuring appropriate measures for less harmful products. This is key to encourage a behavioral change. Now, definitions are quite important, and we respectfully submit that the current ones are insufficient to cover smoke-free products. In its current form, the bill also contains incorrect definitions that effectively limit the scope for differentiation, and they do this by equalizing combustible products, the most harmful, with non-combustible products, which have been scientifically proven to be less harmful. The broad definition of promote in Section 3 will in its current form criminalize the sharing of accurate information, even by health experts, regulators, or members of the public. So we propose that it should be reviewed to enable awareness of smoke-free products. We have provided relevant sections where the differentiation can be further enabled. Honorable members, our proposal to incorporate a harm reduction in this bill is aligned with the growing support for this approach across the world. Many countries have already embedded it in their control strategies or policies, and we have listed some of these countries on the right side of the slide. For example, the USA, in their nicotine strategy, they acknowledge that adults who still need or want nicotine could get it from alternatives and less harmful sources. As recent as 4 days ago, The US Secretary of Health, Mr. Kennedy, said that nicotine pouches are actually the safest way to consume nicotine. Greece, they embrace technology and innovation of these products to help maximize harm reduction. An example of an emerging country like Bulgaria, in their cancer policy, they acknowledge the importance of creating awareness of smoke-free products to smokers. And other countries have gone a step further. They've implemented tobacco harm reduction in their regulations. You have heard a lot about New Zealand throughout these hearings. They adopted a risk proportionate framework for vapes and heated tobacco products, and they had dedicated categories, including different health warnings compared to cigarettes and permitted display of smoke-free products. A country that is considered to be progressive and developing, Philippines, adopted dedicated laws for smoke-free products and differentiated them on the basis of absence of combustion. They also allow communication and promotion at point of sale to increase awareness of these products targeted to consumers. It's about striking a balance. And we can observe that countries that have embraced this balanced approach are already seeing great results. That is, they're experiencing faster declines in smoking prevalence compared to those that have not. And these three countries, there's others more, they understand this balance. And some of the elements include ensuring access and visibility of these smoke-free products to smokers, not to everyone. Access to accurate information about the products for adults, again, so that they are able to make informed choices. And most importantly, and this one is my personal favorite, we need strong safeguards to minimize the risk of unintended use by underage users. Okay. We concur. Youth access is a challenge in South Africa, and it requires urgent attention. On the slide, we provide an array of measures that can be used to clamp down on youth access while maintaining a balanced regulation. I need to stress that whatever measure we get or measures we get to adopt, they need to be coupled with robust enforcement. As Philip Morris, we are not in favor of packaging elements that could be attractive to youth. Some of the examples you see on the screen have nothing to do with harm reduction or even adults for that matter. They should be dealt with decisively. A vape does not have to look like a milkshake or a branded candy for adult smokers to use it. We are in favor of balanced regulation. This bill can and should have strong measures to protect our youth while ensuring that scientifically reduced risk products are available, accessible, and affordable to adult smokers. Let me just end this slide by emphasizing 2 points. Beyond reasonable doubt, we know that smoke-free products can be a life-saving intervention for smokers. However, Chair, they are not meant for and should not be used by those who are underage and never smokers. As Philip Morris, we support efforts to achieving and safeguarding this balance. We know that youth prevention measures work, Chair. E-cigarette use and smoking have significantly decreased amongst high school students in the USA. If you look at the data between the years 2019 and 2024, you will notice a sharp decline. Now, this just did not just happen on its own. It was coincided with stronger enforcement of minimum age laws and against unauthorized vaping. Again, we stress the point of effective enforcement and implementing harsher sanctions for non-compliance. To conclude, honorable members, we believe that making less harmful products available is a responsible and people-centered approach that can benefit our public health. The primary goal of tobacco harm reduction is to reduce the adverse effects of continuing with harmful smoking, which is well documented for decades. We have the evidence, we know it harms. Therefore, a risk proportionate regulatory framework is what we need in this bill. I can summarize 4 points that a risk proportionate regulatory framework can have. The first one is stronger measures on the most harmful combustible products. The second one is differentiation based on evidence, risk and benefits of reduced risk products. The third aspect is ensuring access and awareness of these products for current adult smokers so that they can switch. And most importantly, last but not least, we need stronger measures to minimize the risk of youth access. Our recommendation to the committee is, let us save lives. We've done it before. We can do it again, despite a lot of skepticism. We can do so by regulating based on available evolving scientific evidence. We can adopt tobacco harm reduction strategies alongside control measures. The two are not enemies, they can work together. We need to prevent youth access to these products. They are not meant for underage. We need to recognize better alternatives as part of a broader public health strategy. And differentiating the most harmful products to the less harmful ones, it's very important to achieve this. And we need to enable access to accurate information and access to these reduced harm alternatives for adult smokers. Chair and honorable members, we thank you for the opportunity and we look forward to the questions and interaction. Thank you.
Okay, thank you very much for your presentation. You really got me worried, but you were able to take your time and you finished your presentation very well. Now, can I ask members who want to present, to ask questions, to raise their hand? Let me start now recognizing and writing your name down. Dr. Leroux, you'll be number one, and you'll be followed by Honorable Clark. The third will be Honorable Zungula, and the fourth will be Honorable Van Staden. Number 5, Honorable Mutubatsi. Number 6, Honorable Kumalo. 7, Honorable Sine. Sine for 7. 8, Honorable Shabangu. Let me check if there's another member. Number last, which is 9, Honorable Dr. Letape. Right, in that order, Honorable members, one after the other. Dr. Leroux, number 1, 2, Honorable Clark, 3, Zungula, 4, Van Staden, 5, Mutubatse, 6, Kumalo, 7, Sine, 8, Shabangu, 9, Letape, in that order. Thank you.
Thank you very much, Chair. Thank you to the presenters for your interesting presentation. I just had a few questions. I think the one thing that which we constantly see is the between different groups, or should we say the harm reduction group and the industry group versus the NGO and some academic groups, is this concept of the 95% less harmful, and I can see that 95% is quoted in reports. I just wanted to see, where does this come from, because I've heard it contested by some people. So that's the first aspect, and then the second aspect is nicotine. And again, some people, I think everybody agrees that nicotine is not it's not a cancer-causing substance, but there is quite a lot of debate about the harms. And if you could maybe just quote some articles, you would say it was less harmful. Some other people would say it was more harmful, particularly to cardiovascular health, etc., etc. So it would be helpful I'd like to get your input on that. The second thing I'd like to ask you about is, you mentioned that the importance of access to information, and I think that the big challenge, particularly with the less harmful products, is access to information versus promotion of products. And I think that's the concern that many people have. How do you ensure that there's good, helpful, truthful information that doesn't seem to promote vapes and perhaps promote them to underage people? The third thing is or other non-combustible products. And then I think the third thing is just in terms of again, our context in South Africa, I mean, I'm not going to talk, as you said, there's been a lot of talk about the illegal industry, but I think the question for me is even if people are paying full price for taxed tobacco, it's still quite a lot cheaper than a vape, for example. And if we're trying to, and it seems like that is not a health regulation thing, but it seems to be to do with the taxation and it's taxation and by Treasury. And so, how does one adapt that, and can we do that? Is that a thing that we can do in this bill, or is it something that needs to be done elsewhere? Thank you very much.
Honorable Clerk, I wonder if you can hold on a bit. Honorable Zungula, I heard that you would like to come early because of some challenges you are facing. Can you come through now? Honorable Zungula, if unavailable, then let's go to Honorable Clerk. Take your slot, Honorable Clerk.
Thank you, Chairperson. We've received. Thank you for the. We've received. Thank you for your presentation. First of all, we've received a presentation that stated the amount of nicotine received from vapes and other non-combustible products are significantly higher than those received from cigarettes. What is your view on that? And with what local or international standards do your products currently comply? And are all products held to those standards, or do they differ from region to region? And then Dr. Leroux has spoken about the issue around cardiovascular disease and in the impairing function of body blood vessels. And I won't dwell more on that. If you could just answer that question as well. And then what is your opinion on the UK ban of single-use vapes? Thank you.
Honorable Zungula.
Thank you, Chair. I hope I'm audible. I'll be very. Can you hear me?
Yes, can hear you.
All right. I've got a few questions. Due to time, I just shoot straight to the questions. They've indicated that one of the challenges with the bill is around consumer rights. What do you mean by consumer rights, and how does this bill undermine that, and what would be the consequences? The second question is that the committee has received submissions that indicated that harm reduction in South Africa, when it comes to tobacco, is dismally failed after being implemented for the past 15 years. Therefore, the question would be, was this committee should we place any weight on your submission, given that you're advocating for harm reduction? And then the last question is that on the oral nicotine products, what would be the appropriate labeling and packaging requirements? And
Honorable Van Staden. Let's follow each other, honorable members.
No, I thought the member was still busy, so sorry, Chair, about that. Good afternoon to the presenters, and thank you for your presentation. Only 3 questions from my side, and the one is on plain packaging. Did those countries who implement plain packaging stop smoking in large numbers, or did the numbers of smokers decline in those countries? That's the first question. My second question is, do you believe that the illicit trade in tobacco will worsen under new legislation? And if yes, why? And my third and last question is, what have you done on your part to address the illegal trade in cigarettes and tobacco in South Africa? Thank you, Chairperson.
Thank you, Chair. Let me join colleagues who have welcomed the presentation. Chairperson, my question is in relation to slide number 7, where the presenter showed different products having different risks. And I also see you show that water pipe or hookah, as we call in South Africa, has less risk than cigarettes. Then will you then be suggesting that we use it as a harm reduction product in South Africa? If not, why not? If the risk is just about 50% less than cigarettes, is it because harm is harm? That would be my question, Chairperson. Thank you very much.
Yeah, Honorable
Thanks.
Mutubase, you were jumped. You were
Yes.
supposed to be the one asking. So
Yes.
after Honorable Mutubase, it will be Honorable Sine. Thank you.
Yeah. No. Thanks. Thanks very much, Chair. I just waited. Thanks for the presentation. I think as time goes on, you get more educated, and this was very balanced in terms of the presentation that was made. If you can help me here in respect of the single sticks, and mostly in respect of the open and the closed vapes. What is your view on that? Secondly, you have indicated that the current bill equalizes products that are fundamentally different. What are the 3 critical changes that we can do as this committee to incorporate harm reduction and differentiation without compromising our objectives of the public health and protecting the youth? Also, as an industry, what do you think you can do collectively to assist, especially in terms of making sure that those who are not smoking, your outreach programs to help in terms of implementation of the regulation? What is it that we can do to reach out so that the implementation can be successful? And as people who are mostly in the policy space, one of the areas of policy is around making sure that from time to time we assess whether policy implementation is reaching its objectives. What can you advise that we should do in the bill to empower that space of evaluation from time to time? Thank you very much.
Thank you very much, Honorable Chairperson, and let me also join my colleagues in welcoming the presentation. You request that the bill should firstly enable awareness of smoke-free alternatives. Secondly, to review the broad definition of advertising to exclude the sharing of accurate information about smoke-free products. And thirdly, you request the bill to revise the definition of promote, which will prohibit regulators, public health experts, and society from raising awareness about better alternatives. So if PMI is not selling addiction and pushing profits, but only seeking to help people quit combustible tobacco products, why is PMI not advocating for communication and awareness only within a controlled environment like a specialist tobacco shop focused on saving smokers? Smoke-free is not risk-free. How exactly will these communications of risks be managed without creating confusion about safety to unsuspecting young people? Why would Parliament allow the indiscrimination awareness and supply of products that are not risk-free? My second question, Chair, You are advocating for online sales for smoke-free products with age verification means at the point of transaction and delivery. You are, however, silent on the indirect and direct marketing of online sales. How will you delineate marketing from sales? And how certain are you that there will be no gaps in the age verification transaction and delivery process? Thank you, Chairperson.
Thank you, Chair. Let me also appreciate the presentation that we've just received. The presenter indicated that nicotine is not the primary cause of the smoking, the disease the smoking related diseases. But some of the presenters that came here, they indicated that nicotine is toxic and it can affect blood vessels, leading to the high blood pressure. Can you clarify us if nicotine is toxic and can affect blood pressure and can cause cardiovascular diseases? And on that same issue, can you tell us if heated tobacco products contain a mix of chemicals like we find in tobacco and tobacco smoke? And again, you indicated that the Food and Drug Administration in US authorize only menthol flavored e-cigarette. Are you suggesting that in South Africa, we must not allow any other flavor except menthol? Those are my questions. Thank you, Chairperson.
Thank you, Chair. I've only got two questions. Or three. The first one is, can you elaborate on the FDA classification of risk continuum and what criteria they use for that? The second question is, what would you like to see on the final bill? And thirdly, simply, how should we communicate to smokers about the different products? What is your suggestion? Thank you, Chair.
Was that the last member? Okay. Thank you very much. For me, this was a breath of fresh air, and I want to check with you, being a company that is on this industry. What makes you to make these far-reaching recommendations in support of the bill? It's probably something one would not have expected to come so strong from the industry. I'm not sure whether it's because you are leaning on the side of more of the less harmful products, or in fact starts from your slogan or from the message: if you don't smoke, don't start. If you smoke, quit. If you cannot quit, change. Now, this message, where is it appearing in your company, maybe in your leaflets or website, or where do we see this quite often, or is it visible? Number two, the risk-free issue. We are talking about that all of these products have some risk, but you are suggesting that we do less and less of the other. I want to start by saying your comments here, for me, are welcome, because you seem to be going a bit further than what other people in the industry have recommended and have said about the bill. Maybe rather than to say nicotine pouches are, but this is very interesting. In the same day, two presentations have indicated that nicotine pouches should be inserted in that, and we welcome that. We'll then address that. There's something that is new I'm learning from you. Youth access prevention. Youth access prevention. So you are actually leaning towards less and less of these products be available to young people, or young people to take the products other than smoke. Please, your support on these questions from honorable members. But again, please don't ignore mine. I really want to know what makes you as an industry to talk in the way you do on a product that is giving you profits, that you would like it to be really strongly regulated, and you are making even suggestions and add-ons. Let's get your responses, not more than 12 minutes, please.
Thank you, Chair. So with the limited time that we have, Chair, we will bucket the questions into themes. I will respond to the science-related questions, and Themba will respond to the regulatory questions. So, honorable members, as I take you through the scientific response, I want to start by saying that, respectfully, the biggest misconception we often hear is that nicotine causes cancer, and this has been the biggest spread of misinformation. The WHO itself does not list nicotine as a carcinogen, so it does not recognize it as a carcinogen. It is not a cancer-causing agent. And I would like to emphasize that it is not the primary cause of smoking-related diseases. Nicotine is not the primary cause of cardiovascular disease. It has a transitory cardiovascular effect. So this myth has been debunked on this very platform by credible public health researchers who presented prior to our presentation. We know from epidemiological data on Swedish snus that smoke-free products have a reduced risk profile when compared to cigarettes, despite similar nicotine exposure. So I want to share that smoke-free products are designed to deliver nicotine at the levels that are similar to combustible cigarettes. But in general, regulators have established limits to mirror nicotine levels delivered by cigarettes. For example, in the EU, the limit is sitting as 20 milligrams per ml for nicotine in e-liquids. Now, when we look at findings by the FDA, I need to highlight, honorable members, that the FDA granted authorizations on the basis of totality of evidence. So including reduced harmful and potentially harmful chemical formation, reduced toxicity, reduced risk in animal studies, and reduced human exposure, amongst many. So the evidence is clear. There is over 6,000 chemicals in cigarette smoke which are produced, with 100 of them being linked to smoking-related diseases. In smoke-free products, the number is reduced to less than 90% of the 6,000 in cigarettes. So when we speak about smoke-free products, in this case, for the 90%, I'm referring to heated tobacco. So this, to me, as a scientist, strongly suggests harm reduction. And it is on this basis, anyway, that the FDA has authorized these products, stating that they are appropriate for the protection of public health. We simply cannot ignore this. Can't ignore this. We need to strive to find ways to protect the health of our population. And this includes the 11 million South Africans who smoke. Allow me to please re-emphasize, honorable members, that nicotine-containing products exist on a spectrum of risk. And the products that combust or burn or ignite tobacco are the most harmful on that spectrum. Products that do not combust release less toxins. And in the case of oral smokeless nicotine pouches, there are no emissions at all. This is by far less harmful to the adult consumer. In the case of hookah or water pipes, these are combustible products, as what we could see on that risk spectrum, and they are harmful. And the reduction of risk is not significant in comparison to cigarettes. Chair, I was touched by presentations given by the public health experts who conducted research that showed that smokers who switched to smoke-free products experience improved respiratory symptoms in comparison to those who continue smoking. Now, honorable members, I want to emphasize that there is a substantial amount of evidence from independent researchers and public health institutions, government bodies that recognize that these products are significantly less harmful than smoking cigarettes. With that being said, members of the committee, we have submitted a dossier of all the studies we have accumulated over the years to this committee. The science is overwhelming. It's about 19 books worth of research that undeniably shows that smoke-free products are less harmful alternatives for adult smokers who make the choice to continue smoking. Members of the committee, as I hand over to Temba, I want to conclude by saying that let us be guided by the science. Scientific evidence needs to be the North Star that informs our health policies. This is an opportunity for us to accelerate the decline in smoking rates in South Africa. Let us strive to be the example in Africa that will be used as a benchmark. We have done this in the case of the HIV pandemic, and we can do it in dealing with the burden of tobacco-related illnesses. Thank you.
Thank you, Buhle. I will use the remainder of the time to cover some of the questions that the honorable members have put forward. So maybe let me start with this point, honorable members, on regulating these products and strengthening youth access prevention measures. We are in support of regulations for smoke-free products. And what we are saying is that you need a range of measures, some of which we presented tonight, and we are not prescribing to the committee. However, in terms of looking at additional measures, I think one can look at flavors. I think it's something that has been discussed here a lot. If I can just indicate that at the moment, hundreds of flavored e-cigarettes are available in the market, for example, like USA, and the authority there, the FDA, hasn't reviewed them yet. However, what has happened is that they have specifically approved the menthol e-cigarettes. Significantly, FDA recognized that the importance of using flavors for smokers in these free products is essential, including authorizing our Zyn or the nicotine pouch product with a range of flavors that can help adult smokers to switch. Again, the point here, I think when one looks at the flavors, you may have seen in one of the slides, we can all agree that characterizing flavors that are targeted at children and young people have no place in this bill. They have no place at all, and they need to be dealt with harshly. The other point Buhle has already raised, it's on nicotine limits. I think one can look at adopting standards. So in South Africa, there are standards by the SABS. We need to indicate that these are voluntary, but again, it's up to the department to look at these standards, and once adopt them, they do, I think, do important things. One is they set nicotine limits, which you can have for these products at levels that have been deemed safe for human consumption. When it comes to the issue of disposables, the question that was asked by Honorable Leroux, we are concerned about the lawlessness that we see in the market at the moment. However, that should be taken into consideration that there are currently no regulations. And we appreciate that most of that, especially the disposables, are the ones that are facilitating youth access. So as Phillip Morris Chair, we will not be opposed if a measure were to be considered to limit youth access to these products by restricting the availability of disposables, even though that will have a significant impact on affordability. On the issue of plain packaging, we know that countries that have adopted the most extreme measures, including plain packaging, have seen relatively modest declines. And for this bill, we are very clear, all of us, that it's an opportunity for South Africa to accelerate the decline in the prevalence of smoking. By contrast, and that's what we presented today, if you look at countries that have seen the greatest decline in smoking prevalences, they have regulated SFPs differently, and none requires plain packaging or less harmful alternatives. Maybe it brings me to the point that Honorable Mutubatse has asked, the three things that could be enabled in this bill. I think the first one is a risk proportionate regulation. Let us acknowledge that not all nicotine and tobacco products carry the same risk. And on that basis, we will be able to, one, look at stricter measures that we can put on the most combustible and harmful products to limit their availability, as well as making sure that those that are scientifically proven to be less harmful can be accessed by smokers. And what we then can do in addition to that as part of the differentiation is to allow communication and awareness, which is critical. I gave an example of how we drove HIV/AIDS awareness programs. We had to meet people where they were. We had to communicate. We had to provide awareness. The only way we can see a change or a switch in behavior is when we go out and meet people where they are. So awareness and communication is quite critical, and we need to enable it as part of the differentiation. And of course, I've already touched on flavors. Maybe let me quickly, Chair, touch on the point of harm reduction has failed in South Africa. Anyone who shares that message or purport to share that statement, I think is deliberately misleading the committee. Tobacco harm reduction has never been implemented in South Africa. If you look in terms of how we have presented and proposed harm reduction, it is a deliberate approach. It is driven by evidence. It is evidence-based, and it is clear in terms of the intervention that it seeks to have in a public in public health. In this case, tobacco harm reduction seeks to limit the harmful effects of continuing with a harmful conduct, which is cigarette smoking. And we all acknowledge the dangers of cigarette smoking. So no, tobacco harm reduction has not failed, and it deserves a chance in South Africa. And looking at all other interventions in the same public health space, we are confident that it can work. It needs an integrated approach. The last point, Chair, which you asked around our messaging, we call it the triplet in Philip Morris. Yes, we emphasize this a lot. If you don't smoke, even for adults, do not start. It is a consistent message that we share everywhere. We have communicated it to the public. We have it online and even in some of our campaigns. As a listed company globally, this is the commitment that we have made to our investors. And we have been saying it and acting on it for the last decade. And we want to continue on that messaging. Like I said, it's principles that we live by and almost part of our DNA. Chair, I'm not sure how I'm tracking in terms of the time. I do want to thank you and the honorable members for the opportunity that you have afforded us. We remain available to you to provide any additional information or responses to the questions that we may have not addressed in this sitting tonight. Thank you, Chair.
Don't rush. I'm going to use a point of privilege of a chair and then ask just one. I need you to comment on this one. Now, you told us that the products with the highest risk must have the highest restrictions. So would you support the introduction of graphic images and plain packages for cigarettes, which in your graphs was showing that to be the highest in terms of risk? What would be the add on these restrictions compared to maybe nicotine pouches and something else? That's the last one.
Thank you, Chair, for affording us the time. Yes, I can confirm, Chair, as Philip Morris, we are not opposed. We will not oppose any measures or stronger measures on cigarettes. It is part of our smoke-free future to ensure that we see an acceleration to the end of smoking cigarettes. When that happens, it needs to be complemented with a balanced approach that ensures that those products that have been scientifically proven to be less harmful are not treated the same as cigarettes. Because when you do that, if you treat them the same, which we call equalization, which this bill seeks to do, Chair, you are essentially entrenching the use of the most harmful product, because people will always, default to what they know. So hence we are saying allow for awareness, allow for communication, so that we responsibly switch people to less harmful alternatives. And yes, Chair, that is our position.
You are actually having a long comment to say differentiation. Is that what you are saying?
Yes, Chair.
Differentiation. Okay, thank
Yes,
you
Chair.
very much. I was abusing my privilege of being a chair as we are finishing off. Honorable members, thank you very much that you were part of this meeting on this marathon of 4. We have another 4. Is that so, Ms. Machalamba, on Thursday? And honorable members were done. Thanks to the Phillip Morris team. Once again, for me, it was very refreshing to hear an industry, a tobacco industry, supporting this bill this strong. And that will be historic for me. And we will take your comments into collaboration with all others who have contributed. Thank you very much and have a good afternoon. Good evening.
Thank you. Thank you, Chairperson. Thank you, honorable members. We appreciate the opportunity. Good night.
Thanks, Chair.
Yeah. Honorable members,
Chair.
we are adjourning the meeting. Thank you very much. Thanks. Bye-bye.
Don't leave the chair.
Bye.
Thank you, Chair. Thank you to honorable members.
Thank you, Chair.
Done.